Yes. Hello. Good morning to one and all. Santana Sarthalyam, National Level Workshop on Male Infertility and Uttarabasti. Male infertility is a challenge, not a verdict. With the right knowledge and support, there is always a path forward. Pain of infertility is the fear that no matter how hard you try, you may never experience the joy of parenthood. With the joyous blessings of Lord Dhanvantari, myself, Dr. Vindhya Keshav, final year PG scholar, Department of PG Studies in Kaya Chikitsa, and myself, Dr. Afrin, second year PG scholar, Department of PG Studies in Kaya Chikitsa, greet each and every one of you to the most prestigious national level workshop on male infertility and uttarabasti, Santana Safalyam. Infertility affects approximately 40 to 50% of Indian couples. Growing demand for effective counseling and treatment spots the limelight on Ayurveda fraternity for the holistic management of the condition. Many advancements have been put forth in this regard, hence a quintessence of male infertility and uttarabasti. With most gratitude and respect, I greet Dr. B.S. Sridhar Sir, Principal TGMC Ballari, to grace the stage. With utmost privilege and solitude, I greet Dr. Murali Krishna Sir, retired principal, SV Ayurvedic College and Hospital, TT Devasthanam, Tirupati, to grace the stage. With delightfulness and honor, I greet Dr. Madhav Diggavi Sir, Professor and HOD, Department of PG Studies in Kaichikitsa, to grace the dais. With honor, I greet Dr. Rajshekar Ganigar Sir, Professor and HOD, Department of PG Studies in Dravyaguna, to grace the stage. With utmost privilege, I request Srinivas Sir, AEO, TGAMC Ballari, to grace the dais. With delightfulness and honor, I request Dr. Farida Begum Sheikh Ma'am, Professor, Department of PG Studies in Kaichikitsa, TGAMC Ballari. Nothing says welcome quite like warmth and sincerity. Guests bring happiness, welcome them with an open heart. With great privilege and consideration, I request Dr. Farida Begum Sheikh Ma'am, Professor, Department of PG Studies in Kaya Chikitsa TGMC Bellary, for the welcome speech.
Good morning to one and all. With the blessings of Lord Dhanvantari and Taranathji, with the blessings of Lord Dhanvantari and Taranathji, it's given me an immense pleasure to extend my warm welcome to all our distinguished guests, all respected HODs, all my friends and delegates, and all my dear PG scholars to our Tara Chikitsatam 1. A one-day national level workshop on male infertility and uttarabasti, which is going to organize in the collaboration with National Ayush Mission and PG Studies Department of Kaya Chikitsa TGMC Ballari. So, first of all, in the absence, I extend a hearty welcome to chief guest of our today's function, our respected Sri Vipin Singh Sir, Commissioner Department of Ayush Government of Karnataka, Bangalore. Due to busy schedule, Sir could not attend our today's inauguration function. So we wholeheartedly welcome on the behalf of our department and behalf of our institution. So at the same time, I am grateful and pleasure to welcome of our very enthusiastic, passionate, and always helping hand president of today's function, none other than our beloved Dr. B.S. Sridhar Sir, Principal, Taranath Government Ayurvedic Medical College, Ballari. I requested Dr. Shiv Ageri Sir to welcome Sir with a flower as a token of love, a token of respect and gratitude. Next, I am honored and excited to welcome our guest of honor of today's function, Dr. Murali Krishna Sir, MD Ayurveda, retired principal, SVAMC, Devasthanam, Tirupati, Andhra Pradesh. I request Dr. Dodbasaya Sir to welcome Sir with a flower as a token of respect and gratitude. Next, I extended my welcome to our respected Sri Srinivas sir, Administrative Officer, TGMC Ballari, for your ongoing support and encouragement. I request Dr. Uh, Ashok Gutedar sir to welcome sir with a flower as a token of love. I am delighted to welcome our backbone of this institution, none other than Dr. Rajshekar Gandhi sir, to this occasion. So I request Hogar sir, to give a flower as a token of respect and gratitude. So next I am feeling honored to welcome to our dynamic, kind-hearted, inspiring and very well-known academician as well as clinician, none other than Dr. Madhav Digavi sir, Professor and HOD PG Studies Department of Kaya Chikitsa, TGMC Ballari, Organizing Secretary of today's workshop. I request Dr. Rajesh sir to welcome sir with a flower as a token of respect and gratitude. So next I am very happy to wholeheartedly welcome to our Dr. G.R. Vastra sir, retired principal TGMC Ballari, sir, for all your leadership and dedication which has been instrumental in our recent success. Your commitment is truly inspiring us. I request Dr. Ravi Chavan sir to give a flower as a token of respect and gratitude. So next I am very happy to welcome Dr. Swarna Upin ma'am. She is a resource person of this workshop. I request Dr. Rashmi to give a flower as a token of respect and gratitude. So I am delighted and proud to welcome our alumni, Dr. Pramod, Assistant Professor, and Dr. Narsa Reddy, Assistant Professor of Gangavati. So I wholeheartedly welcome. I request Yashwant. I request Yashwant to give flower as a token of love. So next, a very warm welcome to all beloved our delegates, PG scholars to our workshop at Ballari, Karnataka on March 21, 2025. As the actively participating delegates, our contribute to the success of conference. Their involvement in discussion and activities adds value to the event, make it more dynamic and informative for all attendees. So we are delighted to have you join us for this important, skillful, and meaningful workshop. Welcome to all the delegates. At the same time, I feel very happy to welcome all our respected PG and UG HODs of all the departments, all teaching staff, non-teaching staff, office staff, and hospital staff, all my dear PG scholars, all internees, and UG students. We are really excited to all of you have all of you for this Tara Chikitsitam 1, a one-day national level workshop on male infertility and uttarabasti in our TGMC Ballari, as this will be an opportunity for all the PG delegates to learn from each other and grow together. Thank you, Anand.
Thank you so much, ma'am. It's my honor and privilege to welcome Dr. Farida Begum Sheikh, ma'am. I request Dr. Lakshmi Gurle, ma'am, Professor, Department of Rasashastra and Bhaishya Kalpana, to welcome ma'am with a flower as a token of respect and solitude. Thank you so much, ma'am. I solicit everyone to stand up for Dhanvantari Stavana. Om Namami Dhanvantarim Vadidevam Sukasurairvanthitapadapatmam Loke Jararuddhanam Patalabisham Vividaushadinam Dhanvantarim Ramanatham Sarvaroganimukam Ayurveda Pravaktaram Vande Piyushadayakam Sarve Jana Sukhino Bhavantu Sarve Santu Niramaya Sarve Bhadrani Pashyantu Kaschid Dukha Bhagavet Om Shanti Shanti Shanti. Thank you, everyone. I request all the dignitaries on the dais to light the lamp and beautify the stage.
ಸ್ವಲ್ಪ ಆಫ್ ಮಾಡಿ ಅದು. AC ಆಫ್ ಮಾಡ್ತೀನಿ. ಇಲ್ಲ, ಅದು ಕಂಟೆಂಟ್ ಬುಕ್ ನ ಬರೋದು ಮಂತನಲ್ಲಿ ಸರ್, ಮಂತನಲ್ಲಿ ಟ್ರಾನ್ಸ್ಫರ್ ಮಾಡೋಣ ಆಮೇಲೆ. ನನಗೆ ಸಣ್ಣದ I have never seen anywhere else. Donated. To the blood. ಬನ್ನಿ ರಾಮಲಿಂಗ ಬಾ. ರಾಮಲಿಂಗ ಮೇಡಮ್ ಯಾರು ಓಲ್ಡ್ ಸ್ಟೂಡೆಂಟ್ both hands should hold hands. You said not
Thank you, everyone. We are deeply grateful that Dr. Murali Krishna Sir, retired principal, SV College, Ayurvedic College and Hospital, TT Devasthanam Tirupati, has graced our event, bringing their expertise and insight to this workshop. On this occasion, I solicit Sir to speak few words regarding the workshop.
My salutation to Lord Dhanvantari. My respects to the today's chairman of this inaugural function, Sridhar sir, and the organizing secretary of the today's national seminar, Dr. Madhav Dikeviji, and other dignitaries on the dais, and the experts from other parts of India who participated here, who are going to participate, and the delegates who came from the different parts of India to attend this function. Really, I'm privileged to stand before you and extend a few words before you about this function. Actually, I want to recollect that there was a study conducted on doctors and teachers also, that after graduation or post graduation, the knowledge of the physicians are gradually localized to their specializations or the activity which they are executing. And the other areas are gradually depleting off. This was a study conducted in US. Similarly, the same study also, if we observe in our colleagues also, the people who work in the rural areas as a medical officers, their academic knowledge is gradually depleting down, and only focally they are managing certain disease conditions. Updation is not taking place. But these are the seminars where the updation is possible. That is the reason why we need to attend this type of symposium to refresh our knowledge. I recollect one saying from Sri Ramakrishna. Ramakrishna Paramahamsa says, as long as I live, so long as I do learn. This is more apt to physicians because as long as they live, they have to learn. There is no other way. It is just like a copper vessel. Every day you have to clean it, otherwise it will not shine. Similarly, you have to shine your or refresh your knowledge so that this can be translated or transmitted or transformed to the public, needy public. In this contest, I recollect one saying from Homi Baba, which really inspired me when I was a student. The greatness of science is not in the form of knowledge acquired, but in its application. If you say that Ayurveda is great, but it will be great when it is applied. So applied into day-to-day practice. So that application of the science is the validity for the greatness of science. That was the Homi Baba says. And similarly, I remember the George Tata's words. That is also really inspiring me. What he says, the success can never be achieved without deep thought and hard work. So if you want to be a successful physician, you need to have a deep thought and hard work. Both are very important for a successful physician. So this is what I would like to say in this symposium. And
many PG scholars have gathered here. It is an immense pleasure that in our PG Kajikitsa department since 2018 we have started. From then we have series of vertical research on Vajikaran. Male infertility, every batch will be given to assignment. And in the previous batch, Dr. Nalina, she took up a study on oligospermia. That was unique because in that batch all 8 were female scholars only. So she daringly took up that. And at the same time, one of my student and well-known KLE expert teacher, Dr. Surada Upin, she is the first female Rasayana Vajikarana PG scholar in country, and we are very proud to see her as a resource person on Rotary Pariksha. The democracy says female should come forward. They have already came forward. They are doing very good in all areas of industry, education, administration, and everything. And we are fortunate enough to have our passed out PG scholars as a resource person for today's workshop, Dr. Pramod and Dr. Narsareddy and Dhruva Savantri, where and Dr. Manoj. What we want to tell is the postgraduate scholars who are participating, you should grow like that. That a PG scholar is now an invited speaker in our own alumni institute because of their skill, their expertise, their hard work, and their commitment. Not only this, many times what happens is Dr. Vastra sir will be talking all these things. When PG scholar is in the institute, he will be very good Ayurvedic scholar. He performs Basti, he performs Panchakarma. He will do all great service to Ayurveda. But when he goes to the job and market, he starts practicing whichever is bread and butter to him. There is no match. We are from the land of Basavanna, where we believe that what we preach, what we teach, and what we practice should be unique and similar. So I am very happy that our PG scholars who have passed out, they are still practicing Ayurveda, they are teaching Ayurveda, and also their bread and butter is this uttarabasti and male infertility for our outgoing PG scholars. With this enthusiasm, we want all 30 PG Kaichikitsa scholars who are delegates today. You also grow like this. You also develop your skills like this. Whatever we have developed. Actually, today, many of the scholars have given greetings. One of the pioneer is BOA President Dr. B.S. Prasad has conveyed the good wishes for this program. All the principals of Karnataka and Andhra Pradesh, Maharashtra, they have conveyed the greetings for this program. Why it is that is, this is a area where you can flourish. Why you have come today? See, from different parts of the states you have come. This is one of the pioneer specialized area where you can sustain, where you can practice, where you can earn money and name and fame. Many people are not there in modern medicine. In the name of andrology and male infertility, there are no much specialties is there. They have only one testosterone injection and some of the male hormone pills, nothing else. I was very fortunate enough to see that Indira IVF Center in China hospitals are there. Indira IVF Center have got franchisee centers. They use Amalaki capsule compulsory for male patients. But if you see that capsule, it doesn't look like Ayurvedic material. Very posh packing. Amalaki capsule is a must in Indira IVF centers every day. And for female, they give Amalaki Kashayam. But that doesn't look like a Ayurvedic product at all. That much of posh presentation and product what they have, Amalaki is Russia. But many people know that Amalaki is Rasayana. But Amalaki has got a reference that it is Russia. So in our research, we have taken a lot of studies on Amalaki, Kushta Amalaki, Kokilaksha, and Swarnavanga. So many trials have been done. You take as a Hamsa Kshira Nyaya, whichever is good, you pick it up. Whichever is fruitful, you take it as a take home message to your future and make use of this 8 hours in the today. You learn some of the theory part in the morning. Reto Pariksha we will tell, and we'll also show you in our CASA lab, and also we will demonstrate you uttarabasti, where 3 delegates can attend one uttarabasti. There are 8 to 10 patients are there. 3 delegates can attend one uttarabasti. We have 2 OTs, and in OTs only we carry out uttarabasti. Till now, None of the patients of uttarabasti have reported any complications or side effects or UTI or infections or antibiotics were needed. From my PG studies, I'm telling you, it is a 3-decade experience. If you follow protocol, no complications in uttarabasti. If protocol is not followed, OT system is not followed, there will be complication. So with these things, we encourage the exchange of experience, knowledge, or skill, so that our skilled postgraduate scholars of Kaya Chikitsa should practice Ayurveda and they should flourish in market. That is the only concept of this. Tara Chikitsitam is Taranath Chikitsa Siddhantas we are telling you, and Tara means it is star. Taranath itself is a star famous personality in Ayurveda, and Taranath Institute is also a star institute. You can see it is not looking like a government institute. All advanced technology, advanced equipments, infrastructure, KMERC and DMF fund. Dr. Rashekar is very keen about infrastructure development and high-tech facility to Ayurvedic people. There was one time when Dr. Vastra sir knows that there was no separate building for us to have infrastructure development. But due to the government's central and state government's policies, now we are getting a lot of inputs to Ayurvedic centers. With this, I am thankful to Commissioner and also the National Ayush Mission for giving us an opportunity. The team of Kaya Chikitsa Department of Taranath College is presenting you a unique subject. Male infertility is not treated by all allopathy doctors. They say that count cannot be increased. This is what normally gynecologists tell. Count is not increasable, but we can improve. But we can increase the count, we can increase the motility, we can reduce the abnormal forms, we can make a lot of development in our CASA based laboratory. Why we have established this? When B.S. Prasad was my senior at Jamnagar, we had a dream of bringing CASA lab to Indian ITRA Jamnagar. But till now it is not possible. But we got an opportunity in Tarnath College that we can get the funds from DMF and develop a CASA laboratory, which is very costly. If you just touch anyone where, it will change the report. That much of sensitive sensors are there in that. In that, our PG scholars are working. Vertical research is going on. Extended research will help you to learn. Even though you are working in Kaichkisa department with different titles, take up this as one your challenging project. As a side project, you can start from today, understanding male infertility management and also develop your career in future. My bread and butter since 1998 is male infertility and uttarabasti. I used to do uttarabasti in private nursing home OTs, and we have Ayurvedic facility now in our institute. It is possible in government sector, private sector, personal your clinic sector. If you have this much of cooperation, our Shella Tantra department head is very keen and he gives lot of encouragement for our PG scholars to perform uttarabasti in OT. We make planning like that. Morning they will do OT procedure. Afternoon we will do uttarabasti procedure.
This kind of seminars are essential because we know in Ashtanga Ayurveda, Vajikarna is a separate anga. But in the practice till now, it was not given that much importance. We know we have Kaya Chikitsa department, we have Panchakarma and other. Panchakarma is not a part of Ashtanga Ayurveda, but Vajikarna is part of Ashtanga Ayurveda. But that much importance is not given. So it is for us now. We have to develop this department as a specialty department. In that aspect, Tarna, during her time, she has started the andrology lab and subjects were taken in the Vajikarana subject and effort was started. And it is well appreciated. And in future also we will continue to do that. NCISM has made Vajikarana as a separate PG specialty, but it should be developed. So generally feeling is that if there is no academic job opportunities, that department will not grow because everybody wants job after the studies. So if a separate department is developed in the NCISM itself, because Mr. Murali Krishna, Dr. Murali Krishna sir is here, he is in many syllabus committees, then definitely the more scope will come to this specialty. Otherwise, we have to develop it as a super specialty in Kayachis. Which is good, sir. Super specialties Kayachis are one separate specialty.
It will be just now contemplated to go for DM, sir.
DM,
super
specialty.
DM.
It should be as either with
Doctorate of
medicine. Yes. After Kayachis PG, it should be developed as a super specialty.
DM.
Kayachis and Panchakarma, both those PGs can go for super specialty itself. So, in this aspect, whatever the program is planned for today is really wonderful. I appreciate the Kaya Chikitsa department and their team for a good vision and formulating this program. And my previous in charge also, they have taken the grant from the National Ayush Mission. They have convinced the Ayush Mission project directors to give this program to our institute. I thank the commissioners for giving this program. And we are already running out of time. But my request for the organizers that those guest speakers came from a very long distance, give them enough time, don't curtail their time. So if it is prolonged also, please conduct it. If beyond 4:30 also you conduct it, all the deliberations should be properly conducted and the outcome should be there. And your PG, ask your PG students to record everything and bring one compendium out of today's presentation. It will be preserved and it will be useful for others also, those who have not attended today. So finally, I thank the organizers for giving me this opportunity, and in the future, deliberations will be very useful. Hoping that I conclude my speech. Thank you. Thank you, one and all.
Thank you, sir. Now I request Dr. Ramlin Muga studies in Kaya Chikitsa for the vote of thanks.
ಶುಭ ಮುಂಜಾನೆ ಪಂಡಿತ್ ತಾರನಾಥ್ ಹಾಗೂ ಎಂ ವಿಶ್ವರೆಡ್ಡಿ ಸರ್ ಅವರಿಗೆ ನಮಸ್ಕರಿಸ್ತಾರೆ. ಇವತ್ತಿನ ಈ ಕಾರ್ಯಕ್ರಮದ ಅಧ್ಯಕ್ಷತೆ ವಹಿಸಿರ್ತಕ್ಕಂಥ ಹಾಗೂ ನಮ್ಮೆಲ್ಲರ ಬೆನ್ನೆಲುಬಾಗಿ ಆಗಿರ್ತಕ್ಕಂಥ ಡಾಕ್ಟರ್ ಬಿ ಶ್ರೀಧರ್ ಸರ್ ಅವರಿಗೆ ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಆಗಮಿಸಿ ಅವರ ಸಮಯವನ್ನು ನಮಗಾಗಿ ನೀಡಿರುವುದಕ್ಕೆ ನನ್ನ ಪರವಾಗಿ ಧನ್ಯವಾದಗಳು. ಇವತ್ತಿನ ಕಾರ್ಯಕ್ರಮದ ಚೀಫ್ ಗೆಸ್ಟ್ ಆಗಿರ್ತಕ್ಕಂಥ ಡಾಕ್ಟರ್ ನಿತಿನ್ ಸಿಂಗ್ ಸರ್, ಕಮಿಷನರ್ ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಆಫ್ ಆಯುಷ್, ಗವರ್ಮೆಂಟ್ ಆಫ್ ಕರ್ನಾಟಕ, ಇವರಿಗೂ ಧನ್ಯವಾದಗಳು. ಈ ಕಾರ್ಯಕ್ರಮದ ಗೌರವ ಅಧ್ಯಕ್ಷರಾಗಿರ್ತಕ್ಕಂಥ ಡಾಕ್ಟರ್ ಮುರಳಿ ಕೃಷ್ಣ ಸರ್, ರಿಟೈರ್ಡ್ ಪ್ರಿನ್ಸಿಪಲ್ SBR ಕಾಲೇಜ್ ತಿರುಪತಿ, ಅವರಿಗೂ ವಂದನೆಗಳು. ಈ ಕಾರ್ಯಕ್ರಮದ ಸಂಘಟನಾ ಕಾರ್ಯದರ್ಶಿ ಆಗಿರುವ ಹಾಗೂ ನಮ್ಮ ಮುಖ್ಯಸ್ಥರಾಗಿರ್ತಕ್ಕಂಥ ಡಾಕ್ಟರ್ ಮಾಧವ್ ದಿಕಾಲ್ ಸರ್ ಅವರಿಗೂ ವಂದನೆಗಳು. ಪ್ರಾಧ್ಯಾಪಕರು ಹಾಗೂ ದ್ರವ್ಯಗುಣದ ವಿಭಾಗದ ಮುಖ್ಯಸ್ಥರಾಗಿರ್ತಕ್ಕಂಥ ಡಾಕ್ಟರ್ ರಾಜಶೇಖರ್ ಗಾಣಿಗೇರ್ ಸರ್ ಅವರಿಗೂ ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಆಗಮಿಸಕ್ಕೆ ಧನ್ಯವಾದಗಳು. ಕಾಲೇಜಿನ ಸಹಾಯಕ ಆಡಳಿತಾಧಿಕಾರಿಗಳಾಗಿರ್ತಕ್ಕಂಥ ಶ್ರೀ ಶ್ರೀನಿವಾಸ್ ಸರ್ ಕೆ ಅವರಿಗೂ ವಂದನೆಗಳು. ಈ ಕಾರ್ಯಕ್ರಮದ ಸಂಯೋಜನಾಧಿಕಾರಿಯಾಗಿರುವ ಡಾಕ್ಟರ್ ಪರಿದಾ ಮೇಡಮ್, ಪ್ರಾಧ್ಯಾಪಕರು ಕಾಯ ಚಿಕಿತ್ಸಾ ವಿಭಾಗ ಅವರಿಗೂ ಧನ್ಯವಾದಗಳು. ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಆಗಮಿಸಿ ನಮ್ಮನ್ನೆಲ್ಲ ಆಶೀರ್ವದಿಸಿದ ಡಾಕ್ಟರ್ ವತ್ಸತ್ ಸರ್ ಅವರಿಗೂ ಧನ್ಯವಾದಗಳು. ಈ ಕಾಲೇಜಿನ ಹಳೆ ವಿದ್ಯಾರ್ಥಿ ಸಂಪನ್ಮೂಲ ವ್ಯಕ್ತಿಗಳಾಗಿ ಡಾಕ್ಟರ್ ಸ್ವರ್ಧಾ ಮೇಡಮ್, ಕೆಎಲ್ಇ ಕಾಲೇಜ್ ಬೆಳಗಾಂ ಅವರಿಗೂ ವಂದನೆಗಳು. ಈ ಕಾಲೇಜಿನ ಹಳೆ ವಿದ್ಯಾರ್ಥಿಗಳು ಹಾಗೂ ಸಂಪನ್ಮೂಲ ವ್ಯಕ್ತಿಗಳಾಗಿರ್ತಕ್ಕಂಥ ಡಾಕ್ಟರ್ ಪ್ರಮೋದ್ ಸರ್, ಮನೋಜ್ ಅಂಡ್ ಡಾಕ್ಟರ್ ನರ್ಸಾರೆಡ್ಡಿ ಅವರಿಗೂ ಧನ್ಯವಾದಗಳು.
ಮೇಡಮ್ ದುರ್ಗಾ ಮೇಡಮ್,
ದುರ್ಗಾ ಸಾವಂತ್ರಿ ಮೇಡಮ್ ಅವರಿಗೂ ಧನ್ಯವಾದಗಳು. ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಆರ್ಥಿಕ ಸಹಾಯ ನೀಡಿರ್ತಕ್ಕಂಥ ನ್ಯಾಮ್ ಡೈರೆಕ್ಟರ್ ಅವರಿಗೂ ಧನ್ಯವಾದಗಳು. ಎಲ್ಲಾ ಈ ಕಾಲೇಜಿನ ವಿಭಾಗದ ಮುಖ್ಯಸ್ಥರು, ಪ್ರಾಧ್ಯಾಪಕರು, ಸಹಾಯಕ ಪ್ರಾಧ್ಯಾಪಕರು, ಸಹ ಪ್ರಾಧ್ಯಾಪಕರು ಇವರಿಗೆಲ್ಲರಿಗೂ ಧನ್ಯವಾದಗಳು. ಈ ಕಾರ್ಯಕ್ರಮದ ಕೇಂದ್ರ ಬಿಂದುಗಳಾಗಿರ್ತಕ್ಕಂಥ ಎಲ್ಲಾ ಪಿಜಿ ಸ್ಕಾಲರ್ಸ್ಗಳು, ನಮ್ಮ ಕಾಲೇಜಿನ ಪಿಜಿ ಸ್ಕಾಲರ್ಸ್ ಹಾಗೂ ಡೆಲಿಗೇಟ್ಸ್ ಅವರೆಲ್ಲರಿಗೂ ಧನ್ಯವಾದಗಳು. ನೀವಿಲ್ಲದೆ ಈ ಕಾರ್ಯಕ್ರಮ ಯಶಸ್ವಿ ಆಗಲು ಕಾರಣ ಇಲ್ಲ, ಅದಕ್ಕೆ ತಮಗೂ ವಿಶೇಷವಾದ ಧನ್ಯವಾದಗಳು. ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ರುಚಿಯಾದ ಉಪಹಾರ ನೀಡಿರ್ತಕ್ಕಂಥ ಹಾಗೂ ಮಧ್ಯಾಹ್ನ ಸಿಹಿ ಊಟ ನೀಡಿದ ಅವರಿಗೂ ನಮ್ಮ ಪರವಾಗಿ ಧನ್ಯವಾದಗಳು. ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಆಸ್ಪತ್ರೆ ಸಿಬ್ಬಂದಿಗಳು, ಕಚೇರಿ ಸಿಬ್ಬಂದಿಗಳು ಎಲ್ಲಾ ರೀತಿಯಲ್ಲೂ ಸಹಾಯ ನೀಡಿದ್ದಕ್ಕೆ ಅವರಿಗೂ ಧನ್ಯವಾದಗಳು. ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ರಿಸೋರ್ಸ್ ಪರ್ಸನ್ ಗಳಿಗೆ ವಸತಿ ವ್ಯವಸ್ಥೆ ಮಾಡಿಕೊಡಲು ಅನುಕೂಲ ಮಾಡಿರ್ತಕ್ಕಂಥ ಡಾಕ್ಟರ್ ರಾಜೇಶ್ ಸರ್ ಹಾಗೂ ಕೆಂಡಲ್ಮಠ್ ಸರ್ ಅವರಿಗೂ ಧನ್ಯವಾದಗಳು. ಈ ಉತ್ತರಬಸ್ತಿ ಡೆಮಾನ್ಸ್ಟ್ರೇಷನ್ ಗೆ ಓಟಿ ಅನುವು ಮಾಡಿಕೊಟ್ಟಿರ್ತಕ್ಕಂಥ ಡಾಕ್ಟರ್ ಶಿವ್ ಸರ್ ಮತ್ತು ಮನೀಷಾ ಮೇಡಮ್ ಅವರಿಗೂ ಧನ್ಯವಾದಗಳು. ಹಾಗೂ ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಪ್ರತ್ಯಕ್ಷವಾಗಿ ಹಾಗೂ ಪರೋಕ್ಷವಾಗಿ ಯಾರೆಲ್ಲ ಸಹಾಯ ಮಾಡಿದ್ದಾರೆ ಅವರಿಗೆಲ್ಲರಿಗೂ ನಮ್ಮ ಕಾರ್ಯಕ್ರಮ ಪರವಾಗಿ, ನನ್ನ ಪರವಾಗಿ ಧನ್ಯವಾದಗಳು.
Thank you so much, sir. Now we are going to start with the keynote address. So today's layout of national level workshop on male infertility and uttarabasti will be like this. Initially, we'll be having keynote address by Dr. B.S. Sridhara sir. Later on, the resource person, Dr. Swarna Upin Madam, Assistant Professor, Department of Rasayana and Vajikarana, Keher Shri B.M. Kanakanwadi Ayurveda Mahavidyalaya, PG Studies and Research Center, and KLE Ayurveda Hospital and MRC Belagavi is going to present on the topic, a reflection of male reproductive health. Later on, we'll be having a session by Dr. Murali Krishna sir, MD Ayurveda, PhD, Principal, SV Ayurvedic College and Hospital, TT Devasthanam, Tirupati, on the topic Applied Vajikarana Principles in the Management of Male Infertility. Later on, we'll be having a short tea break and we'll be continuing the session by Dr. Madhava Digavi sir, Professor and HOD, Department of PG Studies and Kaya Chikitsa, TGMC Ballari, on the topic Establishment and Andrology Lab and Infertility Clinic. Later on, we'll be having case studies, presentation, and research updates by our alumni. Initially, Dr. Pramod MD sir, Assistant Professor, Department of Kaya Chikitsa, Basavaraj Patil Memorial Ayurveda College Research Center and Hospital will be presenting initially. Later on, Dr. Manoj Kumar Patil sir, Assistant Professor, Department of Kaya Chikitsa, Spurti Ayurvedic Medical College and Hospital, Dr. S.V. Sabudi Ayurvedic Hospital, Gangavati will be presenting. At the end, Dr. Nasareddy sir, MD, Madhava Chikitsalaya Hospital will be presenting on the topic Importance of Glucose Transporter of Vajikarana. At the end, we'll be having lunch. Later on, uttarabasti demonstration, panel discussion, and valedictory function. Now we'll be starting with the keynote address. I appeal Dr. B.S. Sridhara sir, Principal, TGMC Ballari for the keynote address.
As you all of you know, Vajikarna means the Sushruta has explained very well about the Vajikarna Tantra. See, Charaka is a physician, Sushruta is a surgeon. You know, Shreshtas Charakastu Chikitsite. But Sushruta has given a wonderful definition for Vajikarna Tantra, where he told that Alpa Dushta Kshina Vishushka Retasam Apyayana Prasadopachaya Praharsya Janana Nimittam Cha. So he has mentioned many things about the Shukra here. So he has given importance to the male infertility in Sushruta's definition. Alpa Dushta Kshina Vishushka Retasam Apyayana Prasadopachaya Praharsya Janana Nimittam Cha. So the ultimate of this tantra, he says that Prasadopachaya Praharsya Janana Nimittam Cha. That is eugenesis. Eugenesis, one should get a good santana. Santana Sapalya is the name for this one. One should get a good santana. Just santana is not enough. So eugenesis, one should get a good offspring. We know, to grow the country, to get a good society, a good progeny is also important. For that, Ayurveda has mentioned in its Vajikarna Tantra. Vajikarna Tantra, don't think that it is only to treat the infertility. It is to get a good progeny. We know that three pillars of life, Ahara, Nidra and Brahmacharya are the three pillars of life. When the person enters the Grasthashrama, the third pillar, Brahmacharya, becomes Abrahmacharya. The pillar starts shaking. To supplement it, the Vajikarna starts from there. Don't think that Vajikarna is only, if there is a question, it is just like an answer. It is not question and answer. Vajikarna should be started when the Grasthashrama starts. So that's why, see, even Rasayana also mentioned Purva Vaisi Madhyeva Manushasya Rasayana. Like that, Vajikarna should be started when the person enters into the Grasthashrama. So that much wide scope is given in our Shastra. That's why it is mentioned as one among the Ashtangas of Ayurveda. So a part of Vajikarna Tantra is the Chikitsa of the infertility. It is only a part. It is not everything about the Vajikarna Tantra. In this seminar, we are going to discuss about the different doshas of the Shukra. Alpa, Dushta, Kshina, Vishushkaretas. There are different qualities given for the Dushta Shukras, and qualitatively and quantitatively it can be, now we can measure it. How we can measure it? Because you know, to know anything, pramanas are important. Prama means Pratyaksha, Anumana, Upamana, this is Yukti, these are all the means of Pramanas. Now, Pratyaksha, science, what is the difference between science and this is science only believes in the Pratyaksha Pramana. So, to widen the scope of Pratyaksha Pramana, see, you know what are the obstructions in Pratyaksha Pramana? Ati Sukshmatvat, Ati Stulatvat, Ati Durat, Ati Samipyat, even Avaranat. These are all the hindrance in getting the Pratyaksha Pramana. Now the science has developed. Now it is a scientific era. So the development of science, anybody can utilize to overcome the hindrance of the Pratyaksha. Microscope examinations. What you can examine the Shukra. You can find out the different doshas of the Shukras. We can now analyze what is Alpa Shukra, what is Dutta, Kshina, Shushkaretas. All things can be now established by the laboratory examinations and the microscopic examinations. This is the benefit of the development of science for understanding Ayurveda Samprabdhi. If you don't understand the samprapti of the vyadi, the chikitsa will not be perfect. To understand the samprapti, yatra kavai gunya. So we have to understand the kavai gunya. Otherwise, we cannot give the shuddha chikitsa. To understand the samprapti of the disease, the modern scientific developments are very useful, and they are made available in this institute. And in this next presentations also, they are going to present it. Then, after analyzing the samprapti, next is chikitsa. If you understand the samprapti in a subtle manner also, in subtle things of the samprapti can be understood, then giving chikitsa is not a problem. So we know Shukra is Soumya Guna Pradhana. Artavam Agnayam Soumyam Shukram. This is a broad classification. Sushruta, once again, Sushruta has mentioned. Soumyam Shukram, Artavam Agnayam. In that line only the treatment should go. So Soumya Guna means what we have to do here. Soumya Guna Vruddhi should be there, and Shuddha Soumya Guna should be there. In that aspect, we have to take care of the Panchakarma facilities. So Panchakarma, they mention Bijam Bhavati Karmukam. So to get a good offspring, good a progeny, Bija should be Karmukatva should be there. To in the beginning, I told Ahara is very important. In the Ahara Krama, Ahara Bhojana Vidhi Ayatanani, all these are very important. or not for the quality of the food. Economically, it should be viable. They may put more pesticides, they may put more manures, organic manures. So these things will alter the quality of the food. So good quality of food is required. And the nidra, nidra means यदातु मनसि क्लान्ते कर्मात्मनः क्लमान्वितः विषयेभ्यो निवर्तन्ते तदा स्वपति मानवः. So because of the work stress and tension, the quality sleep is now it's a dream. Quality sleep is difficult now. So how many people are having quality sleep? Nidrayatam balam pumsa. So nidra, if it is not there, then how one can have a strong life? That is one among the three pillars. So stress is causing disturbance in the nidra. So once again, the one more pillar is weak. So it is also causing the damage effect on the shukra quality of the shukras. All these factors you are going to learn in the next guest lectures. Then finally, the andrology lab, which we have established here. So the practical aspect will be there. In that practical aspect, uttarabasti is also there. The remedy for the shukra doshas. So you are going to learn about that. With these few words, I thank the organizers for giving me the opportunity to tell few words about the today's program. Thank you, one and all.
I wholeheartedly thank Dr. B.S. Sridhara sir for the keynote address. I request Dr. Madhavadi Kavi sir, Dr. Vastrat sir, Dr. Murali Krishna sir to felicitate sir as a token of respect and gratitude.
Keynote speakers. Keynote speaker.
Thank you, everyone. Now we are going to start with the official sessions. It's my honor and privilege to call upon Dr. Vastrat sir, retired principal, to be a chairperson for all three sessions. Thank you, sir. It's my honor to call upon the first resource person, Dr. Svarda Uppin ma'am, Assistant Professor, Department of Rasayana and Vajikarana, KLE Ayurveda Hospital and MRC Belagavi, to grace the dais. Few words about ma'am. We are honored to welcome Dr. Svarda Uppin ma'am, an esteemed expert in Ayurveda, specializing in Rasayana and Vajana, a graduate of Rajiv Gandhi University of Health Sciences, Bangalore. She earned her master's from KLE Academy of Higher Education and Research, Belagavi. Currently, she serves as an assistant professor in the Department of Rasayana Evam Vajikarana at KEHS Shri BMK Ayurveda Mahavidyalaya and also heads the Srishti Fertility Center at KLE Ayurveda Hospital, Belagavi. Dr. Uppin is an active member of several prestigious committees, including the Bureau of Indian Standards and the PG Syllabus Framing Committee for NCISM. With expertise in male and female infertility, sexual dysfunctions, preconceptual care, and promotive medicine, she has mentored numerous postgraduate scholars and led significant research projects in infertility, regenerative medicine, and bioinformatics. Extends internationally, having served in internal and emergency medicine at Radford Hospital, North California, USA. She is currently the overseas coordinator at KLE Ayurved and a distinguished speaker at various national and international platforms. We are privileged to have her with us today to share her invaluable knowledge and insights. Let's extend a warm welcome to Sweta Ufin, ma'am. Over to you, ma'am. Thank you, Doctor. A very good morning to one and all. Respected dignitaries, invited speakers, expert faculty members of the institution, the delegates and the committee members. At the outset, I would like to express my gratitude At the outset, I would like to express my gratitude to Sir Dr. Madhav Digavi, HOD, PG Studies in Kai Chikitsa, for keeping me in mind when he thought about this workshop. I would also like to express Dr. B.S. Sridhara, Principal, and the entire team of Taranath Government Ayurvedic Medical College in association with NAM for for inviting me and having me here as a speaker. Thank you. Okay, so with offering salutations to the Almighty and the elders, we will start with the session on understanding the importance and evaluating the male reproductive system. So when we talk about reproduction, and we understand reproduction right from our school biology, right? But then clinically, what we see is how the females, the infertile females, are more visible in the society, and it dominantly affects their identity and the societal value as well. And can anyone guess these? On the left and right. Names. Name given to Louis Brown. Anyone? Yes, sir. I was just expecting the answer from the scholars. So she's the first test tube baby, the world's first test tube baby. And obviously, the one that is named Durga is second. India's first test tube baby. So she is Kanupriya Agarwal. So what happened is, after the birth of these in the world and of course in India, the entire focus of infertility again came down on the females, because females are the ones who conceive and carry pregnancy. But fortunately, we are now heading towards more acceptance of how the males are also responsible, and few of the factors which are helping in creating this awareness and acceptance is like increased awareness. So awareness increase is not just by we medical people talking, right? So it is by giving outputs, the results of a treatment, what we give. Then again, celebrities talking about how infertility is a major cause and how it has affected them and they have overcome it. Also recognizing the male factor as a public health concern. Then comprehensive evaluation. The importance of focusing both on the partners. We often study Shukra Shonita Jiva Sanyoga, and right from biology we have been studying that how sperm and ovum is required. But then because the female carries, a lot of focus has always been on the female, right? But then now the times are changing. And so how far have we reached with changing times? So since we all like you all are postgraduates, so I'm not going to get into the definition and the etiopathogenesis of infertility because we all already know that. But yes, coming to what we understand today is over the time, now we know that approximately around 40% of the incidence of the infertility is attributed or set down to the male factor. And the recent data, what we have is 1 in 20 males are experiencing reduced fertility.
So then when we talk about male infertility, we have the seminal defects and the spermatogenic defects. When we talk about spermatogenic defects, then the count is less, the motility is decreased, the morphology is hampered, and then there are other set of seminal parameters where unfortunately the contemporary science doesn't consider it to be the cause for infertility, because one of the treatment facilities is the ART when they are bypassing the seminal parameters. But yes, the research and the data definitely tells that how when one parameter of the spermatogenic abnormality is involved, the risk of infertility for the male increases by 2 to 3 folds. When the same, like in the same context where two parameters have been involved, then the risk increases around 5 to 7, and this risk increases to a good fold of 16%, like 16 times when all the three parameters are involved. So when there is a problem, we definitely have solution also. So again, solutions are innumerable, like how we have been listening even to our experts in the morning in the keynote, and to the Gavi sir also, that in the contemporary science we have different set of treatments starting from medical management to surgical management, also the ART. So let us quickly look into certain researches which have been done in the male infertility aspect starting from 1960s till date. So 1960s was the time where the andrology department was officially started in the contemporary science. So, with respect to researches that have been carried out in the conditions of idiopathic normospermia, the treatment is to go for IVF ICSI. In condition of oligospermia, so they have different uh, treatments like testosterone therapy or else clomiphene citrate, which is going to stimulate the pituitary so that it will further set in the circle of HPT axis. Then is the HCG, which is going to stimulate the testosterone for the production of spermatogenesis. FSH is again directly going to help in the production, and ultimately a lot of vitamins. So when all these measures are done, then altogether the research still says that with whatever improvement is seen or not seen, you still post the patient for ART. Even in astheno, there have been this important drug, which is the L-carnitine, which is also naturally secreted in the epididymis. But apart from that, there is the medical management also with this. And again, it says that whatever improvement is seen, the motile sperms and like the sperms with good morphology are again taken and utilized for ICSI and IVF. Similar goes with the teratospermia also. In hyperagglutination, because hyperagglutination could be because of the like anti-sperm antibodies, so their immunosuppressive management is given, and again the same healthy sperms are used for ART. Likewise, we have multiple things like in case of varicocele. So if varicocele is the cause for spermatogenic defects, then what we know here is they treat varicocele, but unfortunately a lot of data says that in spite of treating like surgical but again for the ART purpose and not for natural conception, obviously. But nowadays, the trend is also that in individuals or in the couples who want to delay fertilization or who want to delay conception, who want to delay parenthood, they also are going for sperm freezing. And ultimately, in spite of so many researches going on over so many years, the last option still remains is to go for the donor gametes. Correct. So whatever we have been listening now, may it be the surgical management, may it be the medical management, may it be the ARTs, ultimately the answer to it remains IVF-TC. Correct. So technologically, no doubt, we have grown a lot, but then, like even in the context of global warming to experience extinction, there is a technological development wherein a European supercomputer has estimated or it has modeled the Earth, and then it says that by the end of this century, around 27% of the plants and animals are going to get extinct because of the lifestyle and the environmental factors. So talking about reality and talking about in terms of human beings. So what about humans? If the animals and plants are getting extinct, how do we understand, like, will that environmental effect not be on the humans? Definitely, the impact is also seen on the humans. As we all know that over the past years or generations together, how all the attributes which were given to Y chromosome have reduced, and now it is only helpful in determining the gender or sex of an individual. So likewise, the depletion further continues. There has been studies which have well proven that the SRY gene, which is linked to the Y chromosome, is also now shrinking, and soon there might be no Y chromosome at all. So what do we understand? That there are only going to be females ruling the planet? There is another data from an esteemed hospital, that is Mount Sinai, which is located in New York. Researcher there, Dr. Sean, has been studying the the scenario of male infertility since last 20 years, and her findings are quite alarming. So her data says that the sperm count has been halved in the last 40 years. We will be seeing it's not just what she is saying, but even we have proofs of it with depleting WHO values. Her data also says that by the end or by 2045, the median sperm count might also hit up to zero. Now, this is a concern we all know. It is a well-known concern. But what is more alarming is that her data shows that there is no signs of improvement in the present trend, in the present medical management, demonstrating that the male health reproductive system is actually worsening. Now, interestingly, the Western world knows this, and they have already started looking for more solutions to it. Solutions in what terms? We have already seen ARTs. Now they are looking for solutions in terms of getting gametes from the bone marrow itself. So again, in the last 2 decades, we have seen that how they have been successfully able to get the sperm cells or the germ cells and into spermatogonial cells in the mice, and successfully they have been able to give rise to 7 births in the mouse. The same, they took the mesenchymal cells from the humans who were fertile, and then they tried to develop the germ cells from these individuals. So partially, but successful, they were able to develop up to the spermatogonial cells, but after that, the progression did not happen. So obviously, the research is still going on with this respect. Now, this is what we have been seeing with the contemporary medicine. Now, we are also fortunate as caregivers that our science has a branch known as Vajikaran, which is entirely dedicated to the prevention and health and care of the male reproductive system. It deals with infertility, sexual dysfunctions, eugenics of the couple, male and female, emphasizing more on the males. At the end, we would see that, or rather, you can tell that why is Vajikaran so much focused on males. Yes, so acharyas have defined multiple things. We are all from Kaya Chikitsa, so I'm not going to get into the details of what is Shukra and how it affects, what is its Srotas and its Udbhavasthan and all that. But yes, we will quickly look into what is important. So when acharyas have explained that how Srotas is important, and one of the important Srotas is Shukra Srotas, and they have explained the Dushti, Lakshanas, Karanas as well as Lakshanas. So we will look into the Lakshanas, how it is important. So when the Shukra Srotas is affected, it is vitiated. So one of the abnormality that is seen in an individual is the individual will be suffering from chlamydia. So when there is a chlamydia impotence or erectile dysfunction, basically a sexual dysfunction, that itself is going to hamper in the natural conception or natural intercourse, and again it is going to give rise to infertility. The individual is also going to experience harsha and apraharsha. So there is going to be lack of libido, and with lack of libido, there is going to be lack of orgasm as well. Again, not being able to completely achieve the intercourse, further giving rise to infertility. Acharyas further say that even if a child is born out of this kind of Shukravas Shrotadrushti vitiation, the child who is born with himself be rogi, might develop in near future, like in his later lifestyle, might have alpa ayu or would be even born. It is also said that again, if at all there is vitiation in the Shukrava Shrotas, there could be repeated abortions. There is a good data that in case the sperm health is not good, then there is definitely going to be infertility, there could be miscarriages, and there could be IUGRs also, including stillborn. So now scientifically we are even able to prove this. And of course, all of these things, it is definitely going to disturb the emotional and psychological state of the couple as well as the family. So when there is so much vitiation in the Shukra Shrotas and how it is affected, so let us understand that how we can consider Shukra in various ways. Okay. So coming to Shukra, how we can understand it with respect to sperm or spermatozoas. So there are a lot of references in our classical texts. So Bijam is one, Pumsatva is one, as it depicts the fertility factor. Majja Samudbhava, we just now saw that how gametes are being taken from the bone marrow also. Indriyas, these can be attributed to the spermatozoas. How we can understand it with respect to semen is as it is Ananda Samudbhava. So it is a pleasure factor, that is the ejaculate. It is Rupadrava because that is visible. It is Tejasi and it is the Rekasa. So these are the references how we can understand seminal fluid. And when it comes to Paurusham, Indriya, Virya, Bala, Ojasa, all these are those which attribute to the androgens. So we are merely focusing not only like the spermatozoas or the semen, but overall the Shukra. We consider all of this as one parameter when it comes to infertility and sexual dysfunctions. So again, I'm not going to go into the details of what is the Shukra Lakshanas, which is the Phalavat Shukra. But yes, of course, we all know like what acharyas have told, like how a Shukra or how a semen looks like. It is Patikabam Ravam Snigdam Madhura Gandicha. And then coming to the doshas, so we have two understandings when there is a Shukra Dushti. So with respect to Shukra doshas, one is Shukra Kshaya, and then there is a directly Shukra Dushti. So with Shukra Kshaya, again it is a primary and secondary. So primary is congenital, you can say, like in the context of alpha ratus, we have different understandings that what is alpha. It could be congenital, it could be age related. It is basically idiopathic, and secondary is that which is acquired. And then there is these dushtis which acharyas, Acharya Charaka, Acharya Sushruta have told, and which we will be seeing. The entire presentation depends on that. So here one major thing, what major understanding we can see here is that when we look into Kshaya, so in Kshaya it is the Rasati Dhatu Kshaya. So the patient will also be having generalized weakness and all the Shukra Kshaya Lakshanas will be seen. Whereas in Shukra Dushti, wherein there is directly the vitiation of Shukra, there might not be generalized weakness. The person might not experience any generalized symptoms and he would be totally fine, but only on semen analysis, you would understand that, okay, there is a cause for his infertility. So this is the classification, what we all have seen, read, understood right from our UG times, that Acharya Charaka, he tells the Retudushtis as Penilatanu Ruksha, Vivarna, Pichila Puti, Anya Dhatu Samshrishta, and Avsadi, whereas Acharya Sushruta has told it on the basis of the doshas, like Vataja, Pittaja, Kapaja, Raktaja, or Kunapa, then Granthi Bhuta, Shina Shukra, and Mudra Purisha Gandhi. So if we understand what exactly it is, so it is actually the same. We can classify the same thing here. So Penila Tanu Ruksha is nothing but those are all the parameters which are attributed to the Vata. Vivarna or Ashweta, again we can further understand it with terms of different discolorations. Patikabam Dravam Snigdam Shukla is what is told for the appearance and color of semen. So in case there is Aruna Varna, again that is attributed to Vataja. If it is Pita and Neela, it can be attributed to Pitta Dushti. If at all it is Ati Shweta, then it is attributed to the Kapaja Dushti. So then Puti, Puya, again these are the Kunapa Gandhi, Pitta Dushti Lakshanas also are seen here. In Anya Dhatu Samshrishta, there is different cells apart from the spermatozoa cells. It could be epithelial cells, it could be RBCs. Most predominantly, what we see is RBCs because of the abhighata or because of excessive sexual activity or because of direct injury. So that's where we can understand the like Rakta involvement or RBC involvement also there, but many times you also see epithelial cells. Now, epithelial cells, immature cells, these are all the components of seminal fluid which are other than the spermatozoa cells. But recently, the WHO says that they don't really have much evidence in the clinical finding. And then we have Avsadi, which is again tells about the Ati Gurutva. It has the involvement of Vata Kafaja, and it is also called termed as the Granthi Bhuta. And then we have the Tridosha Dushti, which is nothing Mudra Purisha and foul smelling. I also mentioned the Vata Pitta, which is the Shina Shukra. Shina Shukra is something that we acquired and it can be also congenital. So, how do we understand all these things? So, to understand function or to understand the fertility profile of an individual, the first most important step is to evaluate the person very appropriately. So when we talk about evaluation, it means that if at all now, your Chikitsa pages, obviously we're not dealing with the Prasuti part here, correct? But then, as we were listening, that soon the council has already announced DM and Vajikaran, wherein Kai Chikitsa pages are also eligible. So later on, if you opt for that, you would also be eligible to practice the couple like male and female. So if at all the female is just coming to you, make sure that the partner also comes and vice versa also. So what are we dealing here with the male factor? So first and most important thing is the marital period and the trying period. So it's not necessary that it should be same, correct? The marital period could be like 4 years, it could be 2 years. Maybe they must have planned that like they want to take a chance after some time. So that could be one thing which is important to understand, that what was their trying period and how often were they together. Because in the present times, it is very often seen that the couples are staying apart and they meet once in a while, which might not be her fertile period, and still they claim that okay, they are not able to achieve a conception. There could be another scenario with respect to the marital life and the trying period is it could be a secondary infertility. They do have a kid and they are trying for another one. So the marital life could be like some 10, 12 years and the trying period can still be 3, 4 years. So this history is important to understand how severe and how much they have taken previous treatments as well. So history of any previous conception. So previous conception in terms of live birth or even so even if there is recurrent abortion, it still attributes to the secondary infertility. Now consanguinity is very important. So consanguinity is nothing but adding in the blood relation. So this relation is attributed to up to 3 generations. So this history again holds importance. Now, how does that matter to us? Because when a couple comes to you, they're already married. Definitely, they're not going to advise that okay, you should have a second option. Correct? But as I very well told about conceptual measure, that how Shodhana is important before conception, and that one definitely holds good in terms of consanguinity. Of course, there is data for consanguinity, how we understand that it is because of the dormant genes, the unhealthy genes, which can later become predominant because of the getting married in the same uh, like uh, families. But again, what we see is this is not always possible. Like it is not a compulsory thing, but always safer to be than sorry. So it is good to treat the counsel the patient first and then treat accordingly. Again, history of contraceptives. Okay, I will share a very interesting example. Once a patient like he came and like we asked for semester. This was when I was a postgraduate, and routine we gave the container and we have been and we have how to educate the patient for a sample collection, and we it was not like very keen on this what we were saying, and then we got the sample which was all negative. Then a gap of a week again rechecked and again evaluated him in detail. He said that how is like collecting the samples was through condoms. So many times people do not feel that okay, like whether they are using contraceptives or sometimes the females use contraceptives and then they do not remember that when it was inserted and how long it has been that they are not removed it. So all these details are very important. Also, contraceptives attribute to side effects. So it helps in not conceiving, and later it becomes, as a side effect, it comes scales which responsible for sexual dysfunction and infertility. There are standardized scales available. And the next thing is sexual life. So you need to evaluate if the person's sexual life is satisfactory or unsatisfactory. If it is unsatisfactory, you further get into the details like how often, like where is the dysfunction? Is it the erectile dysfunction or is it the ejaculatory dysfunction? Is it the libido which is involved? You can also get into the details of what is the frequency of their coitus, what is the frequency of masturbation, because many a times if the masturbation is higher, then the male is not going to have satisfaction with the partner, and that again gives rise to lack of libido, and then they do not indulge much into the intercourse, and again that leads to infertility. Yes, so again for these there are scales available. Apart from scales, there are diagnostics and therapeutic devices also which can be used. Understand? You also need to evaluate if the couple and the patients are having adequate knowledge about the postures and of the fertile period. Pubertal age is also again important here because it would take around couple of years for the development of normal spermatozoas. Then personal history again needs to be taken up. Personal history is something that we take for every patient, but here it is very important to specify their habits in terms of what is like what they are consuming, what is the quantity, what is the frequency. Everything needs to be very specific because that also contributes to then even the innerwears. So what material they are using, because as we all know that sugar is Soumya. So in case you can advise to go for loose and cotton wears instead of tight and synthetic wears, because that is definitely going to affect this population. Even the working pattern, whether the person is having night duties, day duties, prolonged duties, or duties, and how is the eating habits in between those duties, how much stress is involved, because we all know that how stress impacts the HPT axis, and that can be there for a good long time of 3 months for it to again subside. Then you go for a detailed examination, general, systemic, local examination. Local examination in terms of observation, palpation of like the entire genital system, right from the penis, the scrotum, the testicles, everything needs to be validated. A rectum examination also needs to be done to evaluate the erection and the ejaculatory dysfunctions, and then coming to the investigations. So I will quickly show. We have developed a male performer where it is just like how we do our CRFs for our dissertations. That all the details have been mentioned in your partner profile, childhood and developmental history, family history, past history, in case there is any surgical history of cryptorchidism or mumps in the past, surgical histories, any infectious history, have they been evaluated before? So general systemic local examination of the scrotum, scrotal contents, and the investigations. So it can be developed in a very simple way that you include all the points, and when you're talking to the patient, you just want this happens to be a very crucial like questionnaire or examination, and then when you're distracted or you're taking a lot of time between questioning the patient and noting it down, the patient himself might get distracted or might start feeling uncomfortable and would not want to do that. So this is for the beginning. Later, obviously, you're going to be thorough in it, and that would not take much time. We are talking about investigations. So after a detailed history and examination, investigations is obviously the next step. Now, with respect to male infertility, there is a huge set of investigations starting from semen analysis. Post semen analysis, you can go for USG scrotum, TRUS, hormonal profile. If that is not working, then you can go with karyotyping. There are certain tests which we do in the laboratory, like the postcoital test, wherein and the sperm mucus interaction, wherein we are assessing the semen along with the mucus for the hostility or non-hostility of the samples. But again, in the contemporary, they do not hold it good because of the invention of the ARTs. But yes, these are very important tests. But then, without performing a semen analysis, nothing of this holds good. The hormonal profile can still be normal when you are having a abnormal semen analysis. Everything can be normal without a semen analysis. Okay, so the first thing that we understand important to evaluate the male fertility is the semen analysis. So why do we even have to perform a semen analysis? For the diagnosis of infertility, for the prognosis of fertility. So with prognosis, we also understand you might get patients when you start practicing for preconceptional evaluation, because with good awareness, people are also very keen on this. And even before subjecting the patient to ART, prognosis of fertility is very important. Nowadays, in my practice at least, we do get patients wherein the male profile is good, the female profile is good, just because it has been some time and they are tired of trying, they just want to go for ART. So again, that becomes a very important thing, that when to subject to ART. When to even diagnose for sterility, the first step remains to be is that of the semen analysis. Then we have to check the effectiveness of vasectomy. So you never know, you might also get patients for this, for further evaluation. So like I said, the semen profile is normal, the female profile is also normal, but then you want to check for natural conception, you need to go naturally, right? So you need to check for the compatibility of the seminal fluid and the cervical mucus. Then to identify the treatment option. So what is important? Whether medically it is sufficient, whether you require surgical management, or whether it's not possible. Maybe the male is a Klinefelter syndrome, or there is completely Sertoli cell only syndrome, wherein the germ cells are like missing. So for that reason, like whether to go for donor, you need to again evaluate this, and of course for forensic purpose. So before getting into semen analysis, we need to quickly understand what a seminal fluid is. Again, I'm not going to get into the details of it because I believe you all know it, especially because full-fledged running on semen analysis. But yes, it is a grayish white fluid wherein there are important organs like the testis and the accessory sex glands which contribute to the seminal fluid. The testis is something which contributes to the spermatozoas. The seminal vesicles is something which is helpful for the, let's say, whitish appearance. Okay, and the prostate and the bulbourethral glands are something which give the mucoid appearance to the seminal fluid. And apart from that, we have multiple components in it which is going to help for the further process of fertilization, transportation, and fertilization of the. So in terms of semen analysis, we have objectives. Is someone's phone? So sample collection, then microscopic examination and microscopic examination. I'm briefly going to tell this because we are going to have a demonstration on semen analysis on CASA. So when you talk about sample collection, three things are important here. First being the abstinence. So whenever you are asking the patient to collect a sample, make sure that the patient is going to have an abstinence of 2 to 7 days. Any reasons? Why? Think. Then the condition of the container, it needs to be sterile, it needs to be wide mouth so that the patient is able to collect it properly without any spillage. And the method of collection. So there are multiple methods of collection. Most commonly used is the masturbation, then is coitus interruptus, and in conditions wherein the patient is not comfortable with both, you can also give them the non-toxic and anti-suicidal condoms, basically plain condoms wherein the collection is possible. So then, once the sample is collected, the most important thing is you label it. The number time and initials of the patient. Definitely initials because identity, privacy, it's all like, and the number of samples because you don't, and numbering the sample because you don't know how many samples you're going to get for the day. Also, you have to mention time either on the container or you can have your own data where you can mention that. Yes. So after that, once you get the sample is going to be a coagulated sample, and then later, as time passes, there is going to be liquefaction of the sample. So how do you understand that the liquefaction has occurred? You can gently tilt the container, and when there is no coagulation you are able to see, then you can understand the sample is liquefied. Until the sample liquefies, do not take it for further analysis. So the normal liquefaction time is. Okay, I don't want answers from Taranath and Kale. Okay, so it's basically 30 minutes plus 30 minutes. So total 60 minutes, wherein ideal is 30 minutes, but you can still wait up to another 30 minutes. But if at all it is not liquefied after 60 minutes, then you have to manually liquefy it by syringing it multiple times, or else you also get proteolytic enzymes, as I was saying, that can liquefy the sample. So after this, you have to watch for the appearance and the color. So appearance, typically a normal healthy sample needs to be opalescent. If it is translucent, it will depict that the concentration of these sperms is reduced. So only on a physical observation, you can say whether the sample is low, normal, or like too normal, which is also not a good thing. And unfortunately, nowadays you don't even get that much. It's very, very rare. Color-wise, grayish white, of course, but then you can also get a yellowish tinge, greenish tinge. Uh, Aruna Varna has been told, which I have personally not seen either. I have seen Neela Varna. Ati Sweta is again, you can see here. Then you go with semen volume. So ideally, semen volume needs to be weighed. But if that is not possible, if you do not have the setup to weigh the semen, then you can just shift it to a graded test tube and measure the volume. So normal volume is sure. Latest 6th edition. Okay, on an average 1.5. Then yes, viscosity. So viscosity is again something which is very important because it again reflects the Kafaja Dushti over here, Kapha and Vataja as well. But why viscosity is important? Because we understand here is that Shukra or the semen is Taila Shobra. So the consistency is like that of the Taila or Shaudra. And similar is the consistency of the cervical mucus also. So as you all understand that water and oil doesn't mix, it is similar here for natural conception. If the consistencies are different, then it is not going to further help in transferring the seminal fluid into the uterine cavity. pH is again important. The acidic pH or acidic seminal fluid is definitely not going to be helpful, and neither too alkaline is going to be helpful. So the normal is pretty much neutral. 7.2 to 7.8 was earlier. Now it is just 7.2 onward. Then with microscopic parameters, according to Ayurveda, how we can assess is we have two parameters, which is Sadi and Fenila. So Fenila is you create air bubbles in the seminal fluid, and typically the air bubbles should get disappeared within 1 minute. That is a normal thing, because when you're creating air bubbles, there is definitely air bubbles are going to form, but then they should also get disappeared. So if at all, even after 1 minute, the air bubbles are greater or equal to 1 centimeter, then that is considered to be as Fenilata, whereas that indicates the Vata Dushti there. Sometimes there could be so much Vata vitiation that even if you're not creating this like air bubble, the sample in itself is going to have the air bubble. So that accounts for Vata Dushti. Avsadi is wherein it tells about how much kapha vitiation is there. So when you typically take a water in a beaker and you put a drop of cement, it should disperse. Okay, but when that doesn't happen and when strands are formed, then that tells us that there is kapha vitiation over there. Then we have microscopic parameters of motility, morphology, viability, agglutination, aggregation. I am not going to discuss here how it is done because we are going to see that. And DNA fragmentation also. So yes, we missed abstinence. Anyone? If nobody is telling me, you all tell. Why 2 to 7 days? Why 2 to 7 days? just to maintain standardization. Okay. There is like obviously that when there is a longer abstinence, there is going to be yellowish discoloration of the semen or the sperm count would be more, but they would be necrosed or immobile or necrosed on evaluation. And if it is like too early, then there could, because of frequent ejaculates, the count and like the motility can differ. So it's for universal standardization that has been told. So here coming to understanding the Shuddha Shukra Lakshanas and how to understand here for Ayurvedic parameters is appearance wise, Spatikagam, it should look like that. Color wise, it is Shukla. Consistency wise, Snigdha, Dhana, and Taila Shodra Nibam. Then we have volume, where acharyas have told it is Bahu, that is, it is abundant, which is good. For pH, we need not have acidic pH, so Avidari is where we can correlate to this. For viscosity, Pichilata is has been told. Odor, acharyas have told it should be. Liquefaction can be understood in terms of it should be liquid, fluid, and not very thick. Density wise, acharyas have told it is Guru in nature, and presence of fructose is Madhura. So presence of fructose is not a test which is done oftenly. It's typically it is best visible in terms of azoospermia. So now to understand the dushtis, okay. So quickly we'll understand here that how this can like affect. So I mean like how it can signify basically. So phenila is nothing but it is the frothiness in the semen, either by nature or by creating it, which does not disappear. It is definitely vata vitiation, and that too the lagoguna of the vata is involved here, and it can be identified by the physical examination what we just discussed. Tanu refers to alpata. So alpata in terms it's like scanty nature or else even so correlated to some things. So in terms of azoospermia, the sample is going to be like the viscosity is going to typically be not present, and also when you look at it, it is going to can be considered or attributed to Tanu here. So it can be correlated to even decreased number of like the spermatozoas. In terms of count, also we can consider alpha, and in terms of quantity, also we can consider alpha to be. So again, Tanutva is something which will also indicate the decreased liquefaction and also viscosity, like I said. Ruksha is nothing but is dryness as we understand, and again, this is also because of the vitiation of Vata dosha. Now here there can be association of pain during ejaculation and also associated with always necessary, but pain is something which is predominantly seen here. Appearance can be understood here. So appearance wise, when acharyas have told that spatikabam and snigdha is the normalcy, that is missing when your sample is ruksha. So again, this is a physical property that you can understand. Then we have vivarna, which means the semen is discolored. We've already discussed this, and it is obvious when it comes to Ayurvedic understanding. Then puti is again nothing but the putrid smell, that is durgandhi. We can understand here that there is the vitiation of pitta dosha. And how do we understand, how do we perceive this on physical examination? It is through the smell. On microscopic examination, it is the presence of muscles. Then with pichila, it is the obstruction which is caused because of kapha, and that is the reason the semen becomes ati pichila. So it is correlated to extremely slimy semen, that is the hyperviscosity. Here, because physical parameter viscous, there could be thread-like forms in the seminal fluid or while checking the osami, and the liquefaction period is also going to be more generally. Then we have Anya Dhatu. This also we have discussed that how there are different cells made because of injury or maybe because of excessive sexual activity. These spermatozoa cells are a part of the seminal fluid. What you can see RBC, you can see mature cells, you can see round cells, you can see epithelial cells, WBCs. Physically, you can see amorphous matter over there. With Anya Dhatu, we also have the appearance of gelatinous matter and some random strands. Studies say that the gelatinous matter doesn't really have any clinical significance, whereas the strands can affect the counting and count and the motility of this. Then Ausadi is again it is a kapha so there is granthi or grathita that is there in the seminal fluid, which is going to obstruct the free flowing of the spermatozoas, and also it is going to uh, cause obstruction or difficulty in analyzing a sample manually. It can be assessed. Like, how do we understand this? It is like microscopically, you may see decreased motility. It depends upon how viscous the sample is. So this is the sample when it is collected. It is coagulated. I'm not sure if the last people can see, but I hope so. It is a coagulated semen. Post liquefaction, these are the two presentations. Here you can see that there are certain strands, and there are also these are the small air like the bubbles, but this is not considered to be a spinulata. But yes, if at all these are many, and if they do not disappear at all, that is still considered to be anti-Vakushti. Here you can see certain gelatinous matter, which is again clinically insignificant, but they are also present. Like I said, whenever the sample comes, you have to label it. So this is the method of checking volume what we follow. We don't generally weigh it. You can check for the pH, and then there is different types. So like I said, translucent, mostly azu, alpha. There are a lot of things to discuss about alpha, that why are effects there. And then this is a normal semen sample. It is Shukla, it is Pratikabam, it is good in volume. This is Phenilata. This is Phenilata. This is viscosity. Now, honestly, this is not how you assess viscosity. I just didn't get a better picture. What you do to assess viscosity is you take the semen sample in the beaker, you drop in a glass rod, and then you pull on the rod. So the hand which is on is actually tells you that what is the viscosity measured on centimeter scale. This is again two different samples. Milky white, a little lighter. This was severe oligo, not azu, and this was a normal count. Then now this is Avsadi. Okay, so these strands what you are seeing in our water, and this remains. This doesn't go away with time, and that is considered to be as the Kapaladrushti or Avsadi. So this is a like top view of Avsadi, how it looks like, and then these are the spermatogenic parameters. This is fine. So we have developed some code in our laboratory. So please see the reference for better understanding. Abstinence 2 to 7 days for universal standardization. Condition of the container sterile to avoid contamination. Method of collection is any of these what we discussed. Then we have the liquefaction time, which should be 30 plus 30, and if it is beyond that, then that counts for Kapajadushti. Comes for Kapajadushti. Appearance wise, it's supposed to be opalescent. If it doesn't, then we have amorphous matter, presence of it, or anyadhatu, what we can correlate it with. Then we have the color, which is grayish white. If it is not grayish white, it could be like transparent, translucent, or there could be discoloration of Nida, Pita, Krishna, or Vakta, Atisweta. Volume wise, it should be more than 1.5. Otherwise, we can consider it in Ayurveda as alpha and further evaluate why it is alpha. pH is more than 7.2 is according to the recent WHO guidelines. And if so, Initially, it used to be 7.2 to 7.8, and if it would be more than 8.5, then that would be considered as bruksha, because too much alkalinity is going to create brukshata. And again, in such kind of samples, you have to pour. Okay, we'll come back to that. Then there is viscosity, which is 2 centimeter, equal to or less than 2 centimeter is considered to be as normal. This is the the symbol is wrong. It should not be more than 2. It is like less than 2. Beyond 2 centimeter, it is considered to be as hyperviscous. Then we have phenylata. It's supposed to be absent. Sadi, it is also supposed to be absent. Then coming to the motility morphology, the microscopic parameters. So now WHO says that progression is important, like linear progression is important. Previously, it was classified as rapid, slow, non-progressive, and immobile. But because we have to treat it according to Ayurveda, I feel this classification is still good, but you still have to respect and follow the WHO guidelines. So according to them, the progressive motility is supposed to be 32 and non-progressive can be 8. So overall, it's supposed to be around 40%. Anything beyond that or anything more than like around 60% is immobile. So if at all it is immobile, then you have to go for a viability test to check if the sperms are just immobile or they are dead. Okay. Then we have the agglutination. So in case if agglutination is present, then it is considered to be as the chitta dushti, and then we have different gradings to the agglutination and different types of agglutination also. Morphologically, according to WHO, only 4% of normal sperms are considered to be as still a normal morphology. If at all there are defects, then there could be various reasons to those defects, which need to be further evaluated by high-end technology. But how do we, on a basic, whatever we have the knowledge of these spermatozoas and how fertilization occurs, we can attribute it to head abnormality being Papaja Dushti, mid-piece abnormality being Pittaja Dushti, and tail abnormalities being Vataja Dushti. Headless also Vataja Dushti. Presence of pus cells, Puya. Presence of macrophages, again Anya Dhatu and Pittaja Dushti. Presence of epithelial cells, Anya Dhatu, Kapaja Dushti, and immature cells, Anya Dhatu, Vata Pitta Dushti. Now, while reporting analysis, only this information is not sufficient, because we are talking about sexual function as well as the conception in a similar manner. In the contemporary science, that's not how it is. If a person is experiencing erectile dysfunction, they will provoke ejaculation, use the sample for ART. If the person is having premature ejaculation, or collect the sample used for ART. If at all the person is experiencing delayed ejaculation, provoke ejaculation and use it for ART. If at all there is retrograde ejaculation, then still take the sample, use it for ART. But that is not what we are looking in terms of natural conception. So acharyas have again enlisted this also, that if at all the ejaculation is with difficulty and if the volume is less, it is considered to be as a vata involvement over there. If at all there is burning sensation during ejaculation, foul smelling, and the sample is warm on touch. Now, this information the patient will give you. It is Pittaja Dushti. If at all the sample is too viscous and while ejaculating it is not a free flowing ejaculate, then it is considered to be as the Kapha Dushti. If at all it is because of Abhighata, then you will see Raktavarna associated. It could also be because of Adhika Maithuna or excessive masturbation, Hasta Maithuna can also be the cause for it. If at all the person is feeling heaviness in the local region while ejaculating and heaviness induced difficulty in ejaculating, that can be attributed to the So, in spite of having all this information, it is said there is a statement by somebody who says that diagnostic methods for male infertility are based on outdated semen assessment methods that have remained essentially unchanged over the past 50 years. So, what has been unchanged past 50 years? There has been development in understanding the genetic components. There have been development in understanding the DNA fragmentation index. There has been so many developments, and yet the answer to conception is either ART or else infertility. So, what are we failing at? What is outdated? The technique or our health? So, that needs to be evaluated here. So this is what I was talking about, that how over the years the WHO parameters have been changing. So initially in 1980s, the volume was not even mentioned because more the better. So abundant was always good. Over the time, it came to 2 ml to 6.5, then it came to 6 ml, then it came to 5.5 when I was studying. Now recently it was up to recent it was 1.5, and now up to the sixth edition it is 1.4 volume. It's 1.4. Concentration, sperm concentration used to be 40 to 200. Nowadays, that's what I'm saying. That when I was studying, we were at least able to see 100 plus. Nowadays, it is very, very rare that we see 100 plus. My students are also here. It's very rare. When we see a sample more than 100, it's like, oh, really? Wow, like, that's like a good thing. So over the time, again, that has been depleting. Then it became 40, 20, 20, 15, and now it's still 15. Motility wise also, from 60 being normal, it has come down to 40 being normal. Morphology is like next level. 80.5 percentage of normal sperms used to be a normal C in 1980s. Now it is 4%. Uh, pH also, like I said, there used to be a higher range, upper range for it. Now the upper range is also not there. Similar is with volume also. The upper limit of volume is also gone because very few people nowadays are able to ejaculate so much. Vitality also has been like not majorly variation, but still there are variations. So what do we understand here? How does WHO give these parameters? It is based upon the overall population. What is an average rate, correct? Because if at all in today's era also we are following 1980s WHO guidelines, that means that every individual is going to be infertile. So with this, what we understand is the health is literally deteriorating and something definitely needs to be done. So Ayurveda has answers to it, wherein you have to go for prevention. So it's like before we reach this stage, we as Ayurvedic physicians, wherein you understanding what this image is? Understanding the image? So I'm saying that before we reach this stage, we as Ayurvedic physicians should make our visibility in the reproductive medicine, because we have the concept of prevention as well as regeneration. So anyone, what does this mean? Sperms are in the photo. So you can only imagine what sperm is, and then like there is not to be seen in reality. So yes, coming to the important thing here, we have now seen what semen analysis is, what Ayurveda talks about it. So we'll quickly see a few examples to understand that how a seminal report can be interpreted in terms of Ayurveda, and based on that we can give our Vrishya Chikitsas. So I am not highlighting Vrishya Chikitsa here because Murali Krishnan sir would be dealing with the management part, but I'm just going to give examples of number of reports to understand how it can be interpreted. And a quick history also. So this is the case of 37 years male patient with 4 years history of marital life, and since then they were trying and no conception. Sexual life was unsatisfactory. On evaluation, he revealed that he had erectile dysfunction as well as premature ejaculation, and there was even reduced ejaculate whenever he is ejaculating. The partner profile was she had a ovarian reserve, wherein her AMH was really low. So we treated. That's the report. So when you see the report, I have just highlighted the normal ones. 0.5 is the volume pH, which is again Vata-Drishti. High pH, Vata-Drishti. Viscosity is 5 centimeters. Kapha-Drishti. Count is low. Penilata and Avsadi is present, so again Vata-Kapha-Drishti. And so the impression is Vata-Kapha-Drishti. And the condition what we can consider in terms of the contemporary medicine is oligospermia with hyperviscous semen. So post-treatment, there was improvement in volume from 0.5 to 2.2. Count also improved. Yeah, and Ausari was. So here what you see is the condition according to contemporary is normosospermia, but according to our science, there is still Vata Kapha Dushti here. So Penilata and Ausari is still present. Ausari is present. Viscosity is present. There is going to be difficulty in the carrying the seminal fluid into the uterine cavity. Now this is a different story, that she is also having low AMH, but simultaneously when she was being treated. So this is how we can understand that how a report can be, and based upon this this we have to start giving our Drisha dose. This is the second case, 36-year male, 6 years of marital life, and similar is the trying period also. Sexual life was satisfactory and there was no associated sexual dysfunctions. The partner profile was absolutely normal. So on evaluation, sperm count is 8.3, RLP and SLP together was 11%, which is astheno. So here is the thing, Shina Shukra, oligo and astheno and necrosospermia. So like I said that if at all it is plus 58%, then you have to also assess for viability test. So viability test was done typically using eosin Y and it was found to be necros. So post treatment, now pH was initially normal. It increased. So it became 10, but the count improved, the RLP, SLP improved, but there was presence of Penilata and Avsali. So again, once again, here we get the Dushti to be Vata Kapaja Shukra Dushti, but there is presence of, according to the report, it is an orgospermia. So this is another case wherein the person is 37 years with 5 years of marital life and similar is the trying period, sexual life satisfactory. Only on ejaculation on masturbation, you will experience burning sensation. So typically when you would come to provide a sample, you would experience burning sensation. Otherwise, during a sexual intercourse, he did not have these symptoms. The partner had a pinhole loss, so even she was being simultaneously bleeded. For him, we gave Virechana. Okay, we did Shodhana followed by Shamana because when he first came to us, his sample was, the liquefaction time was more than 60. We had to manually break it. Then the viscosity was 8 centimeter and there was no sperm count and there was presence of Penilata and Avsali. So we typically break it manually. We have not kept any proteolytic enzymes with us because our intention is to treat it and not use these proteolytic enzymes even for like further treatments like IUI. And he also had 10 to 12 or like 4 HP epithelial cells. So according to Reto Pariksha, it is Nashta Shukra Dushti, whereas the condition is azoospermia. So we gave him Virechana first, post Virechana we gave him Kapta Bija Churna, Shivgutika, multiple drugs. Over some time, the liquefaction remained the same, but the volume kind of improved, viscosity reduced. So there is improvement, but it is not normal. The count became 1.4, which is improved but not very great. But there was presence of Avsadi and Penilata. RLP, SLP was still there. Shina Shukra, Dushti, what we can understand, along with oligoasthenospermia as the outcome. Further on treatment, now the liquefaction also improved. Viscosity is still the same. Count also improved. Avsadi and Penilata are still present and the motility improved. So here again, Vata Kapaja Shukra Dushti is what we can understand, but there is normosospermia with hyperviscous semen. Okay. Now I am reporting this like this, but if you see the reports from most of the laboratories, they do not mention the seminal parameters. Maybe at Taranath they do. Sorry about that if I am not sure. But otherwise, the laboratories do not talk about the seminal parameters, which is also important so that you are aware that you have to also treat this. Then there is this another case of 36 years, 3 years of marital life. He also had azoospermia. So this sample was like translucent when we got it, which is Vataja Dushti. So again, 9 pH, Vataja Dushti, 4 centimeter, Kapaja Dushti, 1 sperm was detected. So it's basically a cryptospermia. Okay, so whenever I'm talking about Nashtaretas, and any of these reports, okay, so it's basically that all the reports what I have taken here for the presentation, because as per WHO guidelines, any 2 reports can vary at different times. So we picked the second one generally for understanding. So Nashtaretas and azoospermia, post treatment, there has been improvement. pH remains the same. The count has improved to 6.5. Shina Shukra, oligospermia. Okay. Now again, all cases of azoospermia should be able to treat. That's not how it is. There could be various reasons, like I said, if it is a germ cell aplasia or else there is a Klinefelter syndrome. We really don't know. Means I will not rather say here that it is impossible to treat, because then Acharya Sushruta says that to Shukra, how many bastis need to be given? Chala, kai exactly. I mean, this you should tell. I will ask at the end. So you never know. I have this patient one. So he was technically Prasad sir's patient when I was doing post graduation, and then he continued when I joined and sir left. So he was a typical. I mean, he was a diagnosed case of Klinefelter, but then sir kept on giving him medications, and then we kept on treating him because he was aware his family was like the family members are well into this thing, and then they wanted to have some or the other treatment until he grew. So when he came to us, he was like in his teens, like a year ago or so. And when you look at him, you can just not say that he's a case of Klinefelter syndrome. Physically, there is so much improvement in the patient. When he then came, there was obviously the testicles were not palpable, but when he came last time, very minutely we are able to palpate the testicles. As a second opinion, I also referred him to our HOD and export of Shelley department for a local examination, and even like just as a second opinion. And yes, the testicles were palpable. When we asked the patient for a semen analysis, he was like, I'm not yet ready. I feel that if it comes zero or if it comes nil, I might again be disheartened. Let me wait for another some time. So because we have the concept of regenerative medicine, that is Rasayana, we cannot say this is highly it requires a lot of patience, doctor as well as the patient, and it requires a lot of expenses also. So it requires a lot of amount also there. So we have this one more case of 29 years male. Married life was 3 years, trying period was 1.5 years, sexual history was good. He had chronic history of alcohol and smoking since his college days, but since recent times he had reduced, knowing that how it will impact fertility. His partner's profile was she was having PCOD. So on his first report, he had a greenish yellow semen. Count was 3.63. Motility was also reduced. Morphology was also reduced. It was 2%. And he had a good number of bus cells and also macrophages. So here the impression becomes as Siddhoshaja Shukradushti with Anyadhatu Samshrishta, and the condition according to contemporary is Goethe syndrome because oligo, esteno as well as terato with leukocytospermia and partially necrosospermia. So because the immobile was 73 and we got a viability test, which was found to be this. Also, the patient had grade 3 agglutination, which is a hyperagglutination condition as well, which is again of Pitta-Dushti. So that's why we need to account it for Tridosha Jadushti. So post-treatment, there is the sample was still greenish white, but the count had improved, the motility had improved, the morphology had improved, and the pus cells were still there. So here the impression becomes puerethus with leukocytospermia. This is the image of the sample. It is as it is. There is no light effects to this. It was actually a little greenish, yellowish, and pale color. We have another similar case. His friend actually who came for treatment. Everything was same apart from the marital life was 2 years. Same history of smoking alcohol, and but the partner profile was absolutely normal. So even to the previous patient, so for everyone we're doing Shodhana and then Shamana because one of the primary indications of giving a Vajikaran Chikitsa is you do Shodhana followed by Prashar Vajikaran Chikitsa and also for the best benefit of enhancing the Shukra Dhatu. So on the first visit, yellowish white discoloration, 9 pH, nil viscosity, low count, low morphology. So low morphology as 1%. He had taken opinions from the contemporary medicine and the IVF centers had recommended him for a donor sample and not even IVF. So it was to that extent. Now, post treatment, and which is not even a very major one. Okay, so he came in January, and then by the end, almost end of March, the morphology was motility count had increased to 41. It was 6 or something. and the motility had also improved. So when you know exactly what, like if you're able to assess properly and give the right chikitsa, then you get results in time. It's not like, okay, Ayurveda requires a long time and even fertility takes a very long time. Unfortunately, that's the scenario because we blindly treat. We will come to that. There is this another case, 41 years of age, 13 years of marital life and trying period since then. Good sexual life, no associated sexual complaints. The partner had PCOD. When we did his first sample, it was alparatus. We constantly went on doing, like every visit we were doing his analysis and giving him medicine also, and it was still alparatus. That is the time when we suspected for retrograde ejaculation, and we actually tested for retrograde ejaculation, and it then came positive. So in this case, we went in for relation. Of course, we went for uttarabasti with kashaya as well as taila. We also did nasya to regulate the HPT cycle axis along with medications. And so alparatus, 60 minutes is the liquefaction, viscosity is more. So why is this? Because the uh, fluids from the seminal vesicles are not actually coming out, mixing up, and that is the reason the sample is not liquefied. So it is like always hyper. So many times in alpha conditions, you are going to see this. Ausadi is positive, RLT was 5%. So this accounts for alparethodushti, particularly Vata Kapaja, and the condition is hypospermia with hyperviscous semen. So I'm just showing here like 2 reports, but we did many reports over the time. This took us quite a long time. We visited in March 21, and the improvement what we saw was in January 22, because it took us a while to even evaluate the retrograde ejaculation. So grayish white 1.5 centimeter was the viscosity, which is very good for a condition of like retrograde. Ausadi was still present, but the count, motility, and morphology were good. So it was a Kapacha Shukra Dushti and normospermia, but unfortunately, we could not achieve a natural conception here because the patients were very anxious. He was already 41, 13 years of married life, social and family pressure. So we went for IUI, but still successfully conceived. Definitely better than going for a donor sample. Another case here is just very interesting. So he's a patient of 25 years, unmarried. He had a chronic history of excessive masturbation since 10 to 12 years, multiple times a day. Sexually, he was not active. And when he came to us, he was very anxious on his first visit. So typically, we had no business semen analysis, but the symptoms he presented because of masturbation and all those things, we went for local examination, and he himself started insisting for a semen analysis. So after thorough counseling, when we spoke to him, then he was like, no, there was a discoloration in the sample, so he wanted us to check it. And then he had multiple symptoms also, like not symptoms, he had multiple complaints also, like he feels that there is fat being deposited on his like abdomen, which was not. He feels that his ear is twitching, which was again not. I'll come to that. So when he collected his sample, the sample was good red in color. So this was his fear, that why is his ejaculate red in color. This had also happened 2 days before. Since 2 days, I was seeing him around the OPD, that he was coming, going, probably was hesitant, and finally the third day he dropped in. pH was 9, Pinilata was present. So, and then there was pus cells also 8 to 10. So, Anyadhatu Samshrishta, Reto Dushti with hemospermia is the presentation in this case. So, we gave him treatment and subsequently, like multiple times, we kept evaluating his semen analysis just to make sure that the condition is not repeating. So again, this is nothing but a abhigateja condition because of excessive masturbation. He has experienced this. Moreover, why we repeated semen analysis for his satisfaction that now it is normal. In subsequent visits, I picked this one because just to show the difference in like the reporting Reto Pariksha. So yellowish white, 9 pH, normospermia with hyperagglutination, grade 3, and Pittaja Shukradushti. So this read how it was when he first came to us. Another case, 9 years of married life, 4 years of trying period. So typically this was a secondary infertility. clearly teratospermia and hyperagglutination. So kapha pittaja dushti along with teratospermia. We treated the agglutination disappeared and the morphology came to 24. So this can be reported now as prashasta shukra dhatu and normosospermia. This was another case, 33 years of like patient, 1 year of married life, and since then they were trying. It was not even like 1 year, but the reason the couple came or the father of the male patient came along with him was he had a history of delayed milestones, plus he had severe erectile dysfunction. So he was on like tadalafil also, sildenafil, and then tadalafil, and then there was no improvement at all. So that was the reason why they initially came here with severe erectile dysfunction, and whenever with tadalafil he was able to achieve erection, he was not able to achieve a ejaculation so easily. So even he had a delayed ejaculation. So he had delayed milestones. Even now he was not very great in understanding things. He had hearing issues also. So giving a classical Vaman or Virechan was not possible. What we planned for him was we did Sadhya Vamana, Sadhya Virechan, we did repeated courses of Ustadi Apan Basti along with Uttar Basti. And the first time when he had come, so how so this is one example wherein how initially we saw that there was erectile dysfunction, but the count was there. This is an example wherein there is severe erectile dysfunction, and occasionally 2 to 3 sperms were noted on centrifuge. So again, a cryptospermia. But whatever was attend of that, a good amount of sperms were actively motile. So here we can report this as Nashta Shukra and cryptospermia with again repeated treatment. So he came in September 22. In May 23, his count was 3.63. He was fairly able to achieve erection on Ayurvedic medications, of course. Without medications, again, then he was not able to achieve. So Sheena Shukra and severe oligospermia. And so another case here, delayed liquefaction, had to manually liquefy. The semen collected was reduced, but on question there was spillage. Viscosity, pH was high. There was morphological defect, and agglutination was grade 3. Among the presence of pus cells of Granthibuta, Anyadhatu Samshrishta Shukradushti, Terato leukocytospermia. And post treatment, the count grade agglutination improved, but then not come to normalcy. But then that's how you can still correlate. So reporting wise, it can still be on normosospermia, but for it still remains to be a Pakaja Shukradushti, wherein you have to treat it to go for a natural conception. So that's what I'm saying, that impregnation of the partner is possible through multiple ways. But what the question is, do you want to happen it naturally? I strongly believe in the concept of survival of the fittest, and it also is very much linked to this, that if at all, like in later in life, if you see the individuals who are naturally conceived versus individuals who are artificially conceived, definitely there is going to be some differences in like their lifestyle or in the health and multiple parameters. So I would still prefer to go for a natural conception over any ART measures. Interestingly, in the contemporary medicine, how it is achieving conception is so important for them that even if it is being achieved from a donor sample, they are still happy about it and they still report it. But that is not what our agenda is. It has nothing to do with cultural. I mean, of course, it definitely has to do with cultural and familial background. But when it comes to science, you overlook these things and you think for the benefit of the society. So when we have answers, why not be visible and why not provide the care? This is one thing like where Ayurveda really holds good and how we can help the society at large. These are different reports wherein we see that all the reports wise, the impression is normosospermia. But if you look at the first report, viscosity is 8 centimeters, it is 30. 2 pH is so Vataja Dushti is there, where Kapaja Dushti was there in the first report. In the third report, again, Granthi Bhuta is there, so Vata Kapaja Jadushti is there. In the fourth report, it is Alpareta. So we need to understand why this Alpata is there. There could be various reasons for this Alpata. So even in like in surrounding to you, you must have heard about people who have said that, oh, we took Ayurveda treatment and then there has been no result with that. Even I have heard that. And I really feel bad when I hear to such things because people are degrading Ayurveda there. It has nothing to do with who is practicing and how it is practicing. So as long as we understand this, that how we can have our own small setup wherein you can learn and practice Reto Pariksha, then only we will be able to give appropriate results. Now, what I was saying in between is it is very important to ourselves check the analysis while doing the semen analysis. I like to check the slide while doing semen analysis because sometimes the sperms can be hyperactive, revolving in a circular motion, but that is not counted anywhere, or rather on progressive now. Initially, that was not counted. So, how do you understand that? Whether you consider it as a RLP or whether you consider it as a good sample. So, only when you look at the sample, you will be able to see that what line of management you are supposed to give there. So, it's quite important. Like I said, DM will be starting eventually. So, if at all that is, like, if you become a part of it and if you opt for that, then you can definitely have your own setup, own laboratory, and you can also report it because according to the individuals who have been trained and examined can definitely report a sample. So this is Kaylee, wherein we have our own seminal laboratory along with our consultation room. So we have a consultation and counseling room attached as our Srishti Seminal laboratory, wherein we do multiple things like Reto Pariksha, cervical mucus test, postcoital test, and sperm mucus interaction, anything that is related with fertility, except IVF and ICSI and all those things. In like beyond handling cases, max to maxes we go for IUI. That is also very rare, but apart from that, mostly we tend to avoid and go for natural conception. Certain practices at Srishti Fertility are we have developed for all these tests of Pariksha, SMN, PCT, and sperm mucus interaction. We also use different scales to assess sexual dysfunctions, marital dysfunctions, and certain devices also which can help for sexual dysfunctions as diagnostics and not as therapeutics. We have also developed fitness form and SOPs for male and female uttarabasti. We have a department, a branch of Rasayan Vajikaran. So uttarabastis are first trained on mannequins and only then it is allowed on patients. Yeah. Few of the researches in Vajikaran that we have done in Keli, the innovative ones I would just tell about is we have major 3 erectile dysfunction researches. One is ongoing, 2 have been done. One was we assessed the effect of Sheila Pravanga in erectile dysfunctions in all age groups. It was beneficial even in Jarajanya Claybia. There was a whole system approach in erectile dysfunction wherein depending upon the prakriti and avastha of the individual, the treatment was decided, not that you select one drug and give. So that also had a benefit result. For the first of its kind, we are in process of like it's an ongoing trial wherein we are comparing Ayurvedic formulation with allopathy, tadalafil. So it's a randomized controlled clinical trial which has been going on. A few years back, Dr. Sham, he developed Ayurvedic gel condoms and a crossover study was done to evaluate its efficacy over the market available sexual pleasure enhancing condoms and we had like significant results. We also studied sperm agglutination wherein amlaki churna was the drug of choice wherein the content was also assessed in the seminal fluid and also in the blood. Then we have been studying on a lot of chromatogenic defects from oligo to oligoasthen or terato oligo OAT syndrome. So many multiple studies have been done. Vitality tests for HOS, hyposmotic swelling, has been done giving intervention of Shatavari Churna. This was a PhD study by Dr. Huddar. We've also studied on hyperviscous semen, wherein Patyadipata was given and it was assessed that how the intervention with Patyadipata is going to help in reducing the hyperviscosity. So we are not giving artificial proteolytic enzymes or neither we are subjecting the patient for IUI after processing. So that was another significant thing that result that we found. We also tried developing solution with Ayurvedic formulation for semen wash. Okay, so how we have a semen wash media which is used for IUI. So we tried doing it with Kukutanda Kadok Bhasma and Vanga Bhasma. Yeah, separately, of course, 2 different trials. Unfortunately, we were not been able to get very great results with it, but yeah, like anytime the study can be conducted anywhere and we can see if even we can get into that particular thing. But that is for the research basis. For practice, it's always better to go for a natural conception. We have studies on premature ejaculation, and we have done in the past in silico studies for erectile dysfunction, drugs for erectile dysfunction, and this different drugs are still being studied. I'm not going to talk about female factor. So typically, my message would be try developing skills for demonstrating Reto Pariksha, wherein you yourself can demonstrate, evaluate it, and then report accordingly for better prescription. Practice to achieve appropriate reporting, and skills are very important. Just reporting anyone can do, but then being able to interpret it properly is the major and important thing. Diagnose and treat on the basis of Vajikaran principles, because that is how we are going to get great results with it. Promote a culture to evaluate the couple and not just one patient or one person who is coming to you, because it is the Ayurveda says that how we are not treating the disease and we are treating the person as well. So obviously, Vajikaran is also something that you're not treating one person, but you're treating the couple because they are one entity. If you only treat the female and if there is a male factor thing, then still the female will not achieve fertility, right? So still they are termed as an infertile couple. So do develop that culture, provide preconceptional care measures, create awareness for a better and healthy like future generation, and also get into integrative research protocols or practices to explore it, because that is the need of the hours. We are in an era wherein the patients also have no patience. The patients, they do not have time. Their lifestyle is in such a way that they want everything quick. And in the similar way, yeah, the contemporary medicine or the Western medicine do not have very great results. So it's time where we can collaborate and have like better results. So with this, I would end my session here. I acknowledge Dr. B.S. Prasad and Dr. Sukumar Nandigowda, who are my gurus, and my entire team of Vajikaran at KLA. Thank you very much. I think I've taken a lot of time, so we would not be taking questions. Maybe in the panel discussion. With utmost, with utmost gratitude and consideration, I would like to thank Dr. Sweta Upil ma'am for explaining the entire concept of Pareto Pariksha in a very modernized and scientific way. Thank you so much, ma'am. I request Dr. Madhava Dikavi sir, Dr. Vastrat sir, and Dr. Murli Krishna sir to felicitate ma'am, and Dr. Manisha ma'am, Dr. Farida ma'am to felicitate ma'am.
Yes, it was very good information. Lot of information.
Definitely exceeded my time.
No, time is not a share. But
Sure.
caps.
That's too much, sir.
Sir.
Yes.
Actually, we have troubled you.
Thanks a lot, everyone.
Now
Now the second session is going to start. I request Dr. Apri to continue with it. I request Dr. Vatswat sir to chair the session. Chair the I appeal Dr. Krishnan sir, retired principal, SV Ayurvedic College and Hospital, TT Dharmasthalam, Tirupathi, to grace the dais.
Oh, great.
I would like to say two words regarding.
So you are also from
Honored Princess, distinguished scholar, practitioner, and educated in skilled Ayurveda, Dr. Vaidya Krishna Prasanam sir. He had made significant contributions to the field of Ayurvedic medicine over several decades. He was MD in Ayurveda. I him a highly qualified and respected figure in the government. Dr. Murali Krishnan sir served as a principal of SV Ayurvedic College, GT Devasthanam in Tirupati, where he dedicated years of service to the growth and development of Ayurvedic education and practice. His journey in Ayurveda is marked by numerous awards, including the prestigious Divi Srinivasacharyalu Award, Memorial AP State, the Chavali Ramaya Memorial Nagarjun University Gold Medal, and the Vaidyanath Foundation National Award for the best scientific paper on Ayurvedic diagnostics. He was also honored with the title of Doctor of Science by the International University for the Complementary Medicine in 1997. He had held important positions such as being a governing body member of the CCRAS and serving as an expert speaker at various international platforms. His leadership has guided the development of educational syllabi, standard treatment and guidelines, and research methodologies in Ayurveda. So let's just take it on this.
Yes, thank you. Respected chairman of the session, Vasant sir, the organizing secretary of the one-day workshop on male infertility and uttarabasti, Dr. Madhav Vituri, my previous speaker, Dr. Swadha, and the alumni and who are going to present their experiences afternoon, doctors, and the participants. That is, the delegates who came to attend this with a lot of enthusiasm. I'm Dr. Murali Krishna. Of course, there was a big 1.5 hour continuous expression, a very meticulous blend of Ayurveda and modern. Okay, narrating us how to do the retrospiration. We all feel that if such laboratory is there in our institute also, it will be very easy to manage the things. But what we expect is NCSM is also expecting similar type of interpretations even for other tests also, like blood test, urine test, and other tests. Then that will be more ideal for understanding the diagnostics and also at the same time finding out or framing suitable therapies. I take this opportunity because I expect a lot of enthusiasm from you. Otherwise, it's very difficult to even, because nowadays the listening has become very minimum. Only watching, eye, visualization, screen time, and the browsing, these have become very familiar to us. Listening has become very problematic. Once we listen for about 1.5 hours, our mind will not be attentive. So it needs to take some rest. With this introduction, let me say a few words about, because many of my activity, around 30% of my slides are already dead by Swarnajit, and it will be very easy for me to manage the things in given time. So this I start with. Before starting this, let me say a narration. Director SV Institute of Medical Sciences referred his own daughter and son-in-law. Son-in-law was a neurophysician, daughter was a MS gynae. They have infertility and they attended IVF, was failed, and the 3 attempts were made. And then he simply said, you go to Ayurvedic hospital, TTD, and then you attend to, you take the medicine as a layman. They came to me, the couple came to me, and she started pouring number of questions. How your medicines are going to affect you? At what level? What is the defect in us? How you are going to identify? So series of questions. And I asked her, suppose if you get the conception within 3 or 4 months, do you believe that it is because of Ayurveda? Yes, definitely. Then fortunately, they took the medicine. I told them that you have to take as a layman without any interpretation or without any reasoning, rationality, or browsing in the net. So then, fortunately, they got twins, boy and a girl baby. Then she worked in this hospital, Matrutva Hospital, as a gynecologist. Later, she herself kept a separate hospital. So then the trend was continued. After that, this is the prescription you can see here. Prescription. Usually they will not write, they say orally, go to Ayurvedic hospital. They will not write on paper. If they write paper, they think that that is very inferior. Here you can see for detoxification. Matrutva test should be referring case to Ayurvedic hospitals means for detoxification, that is in bracket you can they have written the Panchakarma for fertility enhancement. Them for us, fertility enhancement. And immediately I called her. What was the reason for referring them? Sir, we observed several cases after going to your hospital, undergoing the therapy, Panchakarma therapy, even with a simple method, they are getting conception. So that is the reason why we believe that fertility enhancement is possible by your techniques. So we used to refer to you and you do it, sir. This is because this is a free hospital like this hospital. We do free of cost. So now the infertility, come to the direct landing in infertility. Infertility, this is known to everybody. Infertility is the after at least 1 year of regular unprotected intercourse. That is very, very important. You have to explore while taking the history, whether they practiced unprotected intercourse for 1 year and they tried for that. That is what the trying period and marital life, that both are different. So nowadays in techies, they postpone the conception for about sufficiently longer period. And by the time they reach 30 years, they run after the in vitro fertilization purposes. So now the male and infertility, what is the role of male? The production of healthy spermatozoa is one, and deposition of spermatozoa along with media high in the vagina. That is the second activity. So these two are important. These are directed in our Vajikarna techniques. Vajikarna, if you classify the Vajikarna, they say that we will discuss later. So these two aspects are taken into consideration. What is Vajikarna means a quality term, and it has to be pravartana. It has to be sent directly to the area where it is needed. So infertility factors come the defective production of spermatozoa, that is one aspect, and defective production of seminal plasma that contributes from different areas, epididymis, seminal vesicles, prostate, and even urethral. Failure to deposit semen high in vagina. This is also a problem with the posters and intercourse. So now, this is already dead. I don't want to say because here is a pictorial. 15% of the population now is now major area. Why NCISM is thinking about starting a DM course in Vajikarna? Because now this is a very demanding area. Everywhere the infertility centers are mushrooming. So number of earlier, if you see about 15, 20 years back, there was no such centers. Now you can see every street is having infertility centers because infertility is markedly increased. So now one in every sixth or seventh couple having infertility problems. So now female factors are 50%, combined factors of 20, male factors are 30. Of course, This is a variable. This is 2020 data. Maybe now the recent data is. So now it is says more infertility. Whose fault is this? The society is still blaming the female, but as Swardaji rightly said, but one third female causes, one third is male cause, and one third combination or idiopathic, unexplained. We do not know what was the reason behind. Everything is normal. Even semen analysis is normal, and ultrasound report and HSG is also normal from the female partner, but still the problem is there with the. So many factors are there. Now, these are all actually terminology widely used: aspermia, stenozoospermia, azoospermia, cryptozoospermia, leucospermia. Probably now you are familiar because after listening to Sardaji, all these I need not explain again. So then coming to Shukradhatu also, this actually there are two before actually coming to here. I discussed it with B.S. Prasad. B.S. Prasad was incidentally my student. My student means just I completed my graduation, joined as a teacher. He was in final year. Almost 1 year difference is there with me, and he was my student. And I asked him, actually, you are expert in this field. Can you contribute for my lecture? Because I am a general physician. I deal equally to other diseases also, but focally for the male infertility given by Madhavji, on which I initially rejected not to come here. But but he forced me to come here. I am standing with. Then he said, so Shukra Dhatu and male related Shukra, Retas, Virya. These are the terminology widely used. Now this terminology is there in the MD Rasayan Vajikarna syllabus. So these terminology is there even familiar, which will be known to you. So now these are all already dealt synonyms of Shukra, functions of Shukra, and broad factors of infertility. This is also actually, if you classify them, so there are the different factors: defective spermatozoa, seminal plasma, afferent duct system, that is transportation. The transportation is also an issue. If there are structural problems, then again there is a infertility. Sexual dysfunction, here also the ejaculation at the high vaginal area is also very important. That sexual dysfunction is also going to contribute, and combined factors are also there. Atmajabhav, in addition to that, the providential factors are also there. So whoever come to me, I used to advise them to go at least regularly to their respective religious belief, whether they are Christians, Hindus, or Muslims. And we ask them to pray to their God at least weekly once. Nowadays, that has become like that. Techies come, they never remember the God nowadays. Because for 5 days they work for the company, 2 days work for them. So this is the reason. So I used to ask them to go for as a part of my treatment. So certain factors which are not in our uh, hands, but it is in the. So the Shukra dosha also again it was dealt by Swardaji, and this was also dealt, and this was nicely explained by her. And then Alparetas. So this was the this was the thing which was given by Srinivas, B.S. Prasad. Uh, this hypo, this is from the very beginning, means they never having normal sperm. Normal semen is not there from the very birth. And their secondary sexual characters are also not there. And they are not, there is a problem in hypogonadism. So again, Sheena Retas is another word, Sheena Alpa. So sometimes it appears to be very synonymous, but they are different. This is acquired condition where the pubertal development is there, but normal size testis is also there, decreased after later, the size of the testis was decreased, negative family history, able to elicit etiological factors. So now we can identify the etiological factors for Sheena Retas, and then this is acquired after the puberty. They were having normalcy, but this is what they say: normal initially and then reduced. Maybe several factors are there for that. So now this is also known to you, spermatogenesis. This is actually what we are seeing, the head defects. again mid-piece defects, principal piece, terminal piece, tail defects, head defect. These are all the defects which we use. But total integrity of this spermatozoa is healthy, then only the conception can be possible. So this possibility is there. And the ejaculate containing, as you know, the fluids from the testicular, seminal, prostatic, and bulbourethral glands. So the combination of that. So causes are also again pretesticular, testicular, post-testicular, and so alparatus again. These are the things. Actually, the alparatus is there. You can try with the similar drugs which are very similar to the Shukrala drugs. Usually, the Prakriti, based on the Prakriti also, the quantity of the semen will be different. So usually the Vata Pitta Prakriti people having less semen and cow Prakriti is having more quantity of semen. This is also observed. And usually these drugs are which are very similar to Saumya drugs. They are all Saumya drugs, as Sridhara sir rightly said. The Saumya are going to, here you remember the Amalaki, because we did the Amalaki experimentation on Drosophila model, how it improved the fertility, fecundity, eclosion, and all those things, pupation in the animal models. This was a big project from the science and technology. So viscosity is also another, as she rightly said, viscosity. If the more viscous tattva is there, again we need to go for correction of the condition. But here certain drugs are advised: Triphala, Lohavasma, Ashwagandha, and Kapikapchu. These to, because this is a spectrum, thylum viscosity, the range is given here. As we see the blood also, the color of the blood, the chromic nature of the blood is also given in a range. Similarly, here also viscosity is also given in the range. So grayish white, these are all, but the treatment aspects which I discussed, the yellow, Pitta Dusti is there. With the Shamaka drugs, especially we have a bulk of Vajikarna drugs, individual drugs, combination drugs, but which one, how to identify, this has to be usually has to be considered into prescription. So then this is also, as she rightly said, if it is more than 0.8, 8.5 pH value is there, it appears to be the very ruksha, and ruksha means we have to go for the opposite. Sometimes even the gritas are also effective. You take the Vidarya, the grita is also very effective if the patient is staying in the Jangala Sadharana Desha. And if they are non-upadesha, the simple drugs are also very important, because we come across such observations. The patients from our area, the Tirupati area is the Jangal Sadharana Desha. If they go to Kerala, they get prescriptions of many kashayas, and they take the kashayas and they come back and they start taking, and they are unable to take that. So why? Because the Jangal Sadharana, Rukshaguna is predominantly present here. But once you take the majority of the kashayas which induce the Rukshaguna, then we just turn into the Gritas and everything will be effective. So the place from which the patient is hailing is very important. Inhabitation of the patient, whether he belongs to the Jangala Sadharana or Sadharana Desha or Jangala Anupadesha, these have to be kept into consideration. So this was also discussed. This is also discussed, and this way, it is one point which I want to say: Bijartha. Bijartha is one of the qualities of Shukra, because here the function of Shukra Dhatu, which was mentioned in Sutasthana, Shukra Dhatu transports Bija to target place. This is also very important. So unless it is not reaching to the point where the conception is taken place, that will not be effective. Similarly, this transportation is also very important phenomena in conception. So this amorphous and particulate debris, as she said rightly, several cells and even debris, epithelial cells, RBC, leukocytes, all those things can be seen in the Anyadhatu Samsrishta. Uttarabasti is advised. And Atipichila, Grandhibhuta, Vamana, Anyadhat Samsrishta, Virechana. So then these are all just contributed from the V.S. Prasad mm, um, paper, and which I want to share with you. But let me go to my aspects. What the risk factors. These are all hormonal imbalance. So now let me come to this part, because here we come across certain cases where the patient got the fertility, secondary sexual characters are manifested, beard and mustache, everything was grown. Suddenly it started falling. And then gradually, when we tested, the testosterone levels are less. And when we see the LH, FSH, LH, FSH levels are still low. So then we have to consider the hypogonadism, which is coming from the higher levels, maybe hypothalamus or anterior pituitary area. So then this is actually hypothalamus, gonadotropin releasing hormones are released, anterior pituitary. In anterior pituitary again, follicular stimulating luteinizing hormone, and it works on Sertoli cells, and again it Leydig cells and testosterone and Sertoli cells where spermatozoa is formed. So the two aspects are regularly controlled by hypothalamus. Hypothalamus is in turn controlled by thalamus and limbic system and directly connected to the emotional disturbances like stress and other factors. So now a lot of studies are conducted on Ayurvedic herbs, and they say that there is a one way, that is oxidative stress directly linked to the axis, and another is directly acting on the spermatozoa in spermatogenesis. So both aspects they studied, and ashwagandha like drugs are working at the both levels. That is at the level of hormonal axis and at the level of even working at spermatogenesis at the level of uh, Sertoli cells. So now this is what I want to say here. Certain factors now, food factors, which are abundantly now being taken by us. Recently, one woman patient came to me and asked me, advised while leaving from my chamber, she came back and asked me not to eat the muskmelon. Usually, doctor has to prescribe to her or restrict her. She asked me not to take the muskmelon. Why? Immediately I asked. Because we harvest the muskmelon. Every day we used to spray the pesticides. Even one day before, when it is going to bring to the market, we spray the pesticides. They are very powerful. Infested pests are there. Even one day, if we skip, pests will be there, and total harvest will be spoiled. So now, don't take that, because I want to wish you a long life. So now this is only which we have, it has come to our notice. Even one coconut farmer came to me. He said that around 5 kgs of chemical stimulant is kept in the stem of the coconut. The 25 pieces of coconuts will be usually seen for every year. It will become 250. So now again, water is also spoiled. Everywhere we are swimming in a ocean of chemicals. In this chemical ocean, now there is a theory which has been surfaced in modern system called endocrine disruption theory. Endocrine disruption theory means endocrine glands having a regulatory phenomena of their own, inhibition and accelerations. Both are in their own cycle. So that is, it can be increased or it can be decreased on its own. If you interrupt anywhere, if you disrupt anywhere, that is called disruption, endocrine disruption. If this disruption takes place, there is a chaos, that is a confusion takes place in this hormonal, and then it manifests as a hormonal diseases. I come across one family, husband, wife, 2 children, all are affected by hypothalamus, hypothyroidism. So what was the reason? Hypothyroidism can be possible from mother and 2 children, father or 2 children. But father, mother, and 2 children means there must be a common factor. So then I exploded. She started saying that we regularly take the green juices of herbs, the green juices of vegetables. Vegetables juices are regularly taken by them for last 3 years. As they heard one naturopath's expression in the video, videos in YouTube, and they started taking that. So nowadays, ABC is also a very popular drink in the morning. It is taken. So now this dry, that is raw juices taken from the vegetables, they are going to completely disturb the endocrine axis. That is the reason why many endocrine disorders are surfaced nowadays. So now the obstruction also, we have to identify the obstruction. So obstruction, like factors, congenital bilateral absence of vas difference is a structural problem, really cannot help them. And infectious conditions like chlamydia, gonorrhea, and syphilis, and vasectomy, canalization is sometimes expected by couple when they lost their children. And then this is also one possibility, ejaculatory duct obstruction. These are the factors actually to transportation and problems of sexual intercourse. We come across even some techie couple having these problems regularly. So how to deal with this? Again, there is a description in Ayurvedic classics that बीजभाग pradosham apadyate tada vandhyam janayati. This the concept was very clear. Bija bhaga. So now he's saying CRY. Now gene is now is a very popular. The which gene that is SRY gene. That is in Y axis, which is very important for this spermatogenesis. That is what that gene is lacking, then that is going to cause the problem. So the bija bhaga, and this concept was there, but how it has to be handled. Now, if you have Ayurvedic classics, if you just sum up what are the possibilities which we have, Shukra Shodhana Gana is there. Shukra Shodhana means whatever that the Dushta Shukra is there, Dushta Shukra, that is Soto Dushti, Lakshanas, whatever that is narrated in Susru Samhita and Sharka Samhita, those can be corrected by this. But many of them are not available now. Some of them only available. That is Jivaka, Krishabaka, Kakoli, that is now which are being replaced by Abhav Pratini Dravyas. And now coming to the Shukra Janana Gana, that is to improve the quantity and quality of the semen. This is also these are defective semen, and the quantity quality of the semen are improved by this type of things. And if you see the Shukra Shodhaka Gana, Kushta, Ela Valuka, Katfala, Samudra Pena, Kadamba Niryasa, Ichu, Kanda Ichu, Ichurasa was Ushira. These are all actually described in Ayurvedic classic. These are all abundant available. But once it comes to the Shukra Janagana, but subsequent others like in post-medieval period where we have the Sarangada Samhita, Bhavaprakasha, Vangasen Samhita, there we have abundant description of the Shukra Janaganas. Of course, these are some of them are not available now. So now these are actually the Alparetas, Dushtaretas, Shinaretas, and Vishishkaretas. So there have to classify them. We have to, because broad classifications are there. Of course, now the modern system has classified the semen into different categories. Now we are able to interpret them, but they interpret in our own language and in terms of tridoshas also. But now the Ayurvedic classics have broadly classified them into different defects, and those defects they have given even the different remedies also. Now coming to the Sharagadar Samhitas description. Yasmat Dravyat Bhaves Trisho Harsho Vajikaram. Yada Nagabaladya Bijam Cha Kapikachujam. That is what it is said. So here Kapikachu Bija is one of the, and Nagabaladya. Nagabaladya means Nagabala and others. There is a description of Nagabala and others. Here, actually, while commenting on this Deepika comment, Adamalu says, but there are two categories of Vajikarnas. What are those? He says, Virya Stambhaka Karakam. One is Virya Stambhaka Karakam. Adamalu says in Deepika commentary, while commenting upon that, there are two categories of Vajikarna drugs are there. Virya Stambhaka Karaka, that is Nagabala, Bhanga. So they are restricting the ejaculation. That is, premature ejaculation can be restricted and it can be extended. Ejaculation can be extended speed. And virya vardhana, and that means quantity and quality of the semen can be increased. These examples are also given by Deepika commentary, other audible in this commentary. So then, if you see the Nagabala, we have two types of Nagabala, so which are taken into Gravia Hirsuta, side of Ronesia folia. So these two are, and Kapikatsu also, which is very popular now, which is widely used for Parkinson's nowadays. The Jandopa is one of the important plants, but Jandopa is not produced yet, you remember. Jandopa outer layer of the Kapikatsu is taken for the manufacturing of the Jandopa. You remember that, not the entire seed. So that is the reason why Vanari Kalpa, some people used to give the entire seed for the Parkinson's, that will not be effective. Only the outer layer will be more effective. And that is not Vajikarana drug, and that is not Shukala, but that is having the specific activity like Deopa action. So now the mucinoprurence reduces stress and improves the quality of semen in infertile men. So the K.K. Shukla ji, he published several. He hails from the Department of Biochemistry. Published several papers on ashwagandha and mucina, majority of the Vajikarna drugs, and they worked upon that, and they identified that mucinoprurence reduces stress and improves the quality of semen. Both are linked. Actually, if you see the ashwagandha, also I am going to show, that is also going to reduce the stress, and at the same time quality of the semen also improve. Multiple actions are seen. So because when I was a student in Banaras University, we have a professor in pharmacology used to say that ashwagandha is going to be anxiolytic and antidepressant, but psychiatrists say that antidepressant anxiolytic cannot be same. Anxiolytic, if it is given for longer period, it causes depression. Antidepressants can cause anxiety, but both can be possible by ashwagandha because of cytoindosides which are present in that. Similarly, our herbs having the multiple activities which are modulators, mood modulators, like that. Our majority of the drugs, they take care of the antioxidant, that is antioxidant property to reducing the reactive oxygen species and regulating the endocrine axis, normalcy and spermatogenesis also. So this is also ashwagandha. Ashwagandha here you can say Yasma Sukrasya Vruddhisya Shukralam Hi Taduchate. Ashwagandha Musali. So this is very popular this, because all these are, you can see, the improve the Shukra. A lot of publications are also there which were tested, and we also participated in activity by Science and Technology Group on ashwagandha. Amalaki also, that also I'll show. So this is Shatavari and mostly, and then here very important thing, Dugdham Mashasya Ballataka Palam Majja. Ballataka Palam Majja. Amalani. Amalani means Amalaki Palani. That is commented by Deepika commentator. Pravartakani. Sorry. Pravartakani Katyante Janakancha Retasaha. So they are said as Pravartaka Janaka. So two aspects are identified in Ayurvedic classics, that one is spermatogenesis, semen production must be quality, and Pravartaka, that is, it has to be properly ejaculated out. And Pravartani, this is also another expression which is Swajikarana Dravyanam Visesha, while saying that Vechanam, Bruhati Palam, Jati Palam, Stambhakam Cha, Soshanicha Haritaki. While commenting on that, because Haritaki, you know, while saying about the Haritaki Manushyanam Mateva Hitakarinaha, Kadachit Kupyate Mata Nodarasya Haritaki. But why that Haritaki is given in Soshanicha Haritaki, whether it is a Sukra Soshaka? So this actually, if you go through the commentary, Deepika commentator didn't accept that. He said that it is not Haritaki, Gangeruki. So Gangeruki is given here, and he said that Haritaki is not. It is Gangeruki. This Patantara is there in the text. So that means actually the Haritaki still I have a doubt whether Haritaki is having Soshani Shakti or not. So these are all Bhavati, Haritaki Shukra, Soshani, Hina Karini. So while commenting upon that, he says that Hina Karini, Shukra Hina Karini. So now lot of Vajikarna yogas are also mentioned in Charaka Samhita, but some of them are not available in the market. That is also one problem because we have to prepare and the preparation is not in our reach nowadays because of the lack of raw material. So Uttarabasti, which we are going to learn right today, it has a lot of activity. So studies were conducted on that and how it is effective because the Prasad says that it is not as we expected because Uttarabasti is not as we expected. But what he says, but practical experience we do not know because we do very minimum Uttarabastis. Vamana Virechana and Vastis are done by us. Here, ground reality, what he says in his words, after thorough examination and investigation, we have to start the treatment. After stoppage of treatment, after adoption, after offering prayers rituals, success rate is only 25%. This is what his experience says. But let me say, research outcomes. What are the research outcomes in the male infertility and certain herbs which are narrated in Ayurvedic classics? Related to first Ashwagandha. Ashwagandha is the drug of choice in case of stress-induced infertility. Nowadays, we used to get techies from Bangalore to Tirupati for undergoing infertility treatment. From choice of the drug for them based on their constitution, either we go for Amalaki or Medhirasayana or Ashwagandha. So these are the very important things which have to because stress is one of the factors for them to reduce their activity, that is infertility chances are there for them. So here Abrakabasma, Shatavari Gruta, V.G. Hutar is there, is All India Institute of Ayurveda, also students of one of the students of B.S. Prasad, his publication also there. Role of Vaitanya Samnikara in the management of male infertility. I want to explain how the Vaidhanya Somnifera effect on that. So there are two pathways. One is direct effect on oxidative mechanism. This is a free radical scavenging system, antioxidant. And how it affects on the seminal plasma and germ cells. And reactive oxygen species generation, lipid peroxidation is markedly reduced. Superoxide dismutase catalase activities, vitamin A, E, C are improved because they are antioxidant, innate antioxidants, and essential metal ions levels are increased markedly, and then oxidative stress is markedly reduced, and antioxidant defense is increased. Then ultimately, low sperm cell death and increased sperm parameters and improved male infertility. So this is one pathway. So this pathway is a predominant pathway nowadays in educated people who are working. So another pathway is indirect effect on directly affecting on the brain, maybe from hypothalamus. This is corticotropin releasing hormone, adrenocorticotropic hormone release reduced, and cortisol release is reduced, and then luteinizing hormone is increased, follicular stimulating hormone is increased by activating the gonadotropin releasing hormone and gonadotropins by HPG axis, and finally it acts by LH and FSH. The testosterone levels are improved and spermatogenesis also improved. Prolactin levels are reduced, and ultimately the quality of sperm, quality of semen, and quality that is testosterone levels are also well maintained. So this is another pathway which they identified. In both pathways, the markers are identified that ashwagandha is effective in both ways. That is the reason why, because our drugs are rasayanam tatrusham tad rasayanam. Actually, rasayana vajikarana drugs are not separated much. They are having both the activity, and That is the reason why both are effective in promoting the health or quality of the life. So the proposed mechanism is explained you right now. This is actually the same in descriptive form. So when to consider the Shodhana? Shodhana has to be done because for every patient we do Shodhana, whatever that may be the patient. So first we ask them to go for Shodhana. This is what the the things which we learn from even that fertility enhancement. The Kshetra Bija must be more qualitative. So that is the reason why Shodhana is according to their condition, according to their Prakriti and their symptomatology expressed and their lifestyle and all those factors, even the geographical conditions, which Shodhana has to be executed. That will be decided by the individual because Purusham Purusham Viksha. And the base, we execute the Shodhana. Shodhana is the very first step, that is either Vamana or Virechan karmas are done, followed by Vasti if it is needed. So, what are the conditions? Very low parameters are there. Oligo, spermia, necrospermia, and those conditions, OAT, this is OAT syndrome, very low parameters, the viscosity and even other parameters are also low. And positive family history is there for the infertility. And obese and Anyadhat samsrishta, that is other amorphous leukocytes, RBC, and other debris, epithelial cells are there in the semen. Then also systemic disorders like allergies also, where because it is one of the manifestations of there is a disturbance in the immunological activity. So there also we execute the. So Vajikarana Vasti is also we regularly do. Vajikarana Vastis are done with us after the woman Virechana. Vasti is executed, and we have even research work on the one of the Vastis. And here actually, what are the drugs which this will be shared? I think for them. Is it? Yeah, this will be shared, and you can just go through that. These are different types of Vasti, one from Vangasena and another from Sushrita Chikitsastana. So both are possibly because they are all available raw materials which can be executed regularly. So then this is one study which was conducted under my guideship. Chakradhar, yes, he did the Mustadi Yapanavasti in Shina Shukra conditions. Actually, the thing was Ustad Yapanavasti was given the 7 volume, how it was increased from 1.65 to 2.325. And you can see here, this is the Ustad Yapanavasti on sperm count, but not significant. It has gone to the 14, but it took around 75 days. But not all the days are given before treatment, and only 30th day of treatment we stopped that. Further, we verified for 75 days. And there there is an increase, continuous increase of the sperm count is there, but fertility index is not seen by us. In fact, Mustad Yapan was the sperm total motility. Motility is also markedly improved. Now coming to certain RAM, the Rasoshadas, which we regularly use. Rasoshadas because Andhra Pradesh is the base for the Rasoshadas because Nagarjuna is hailed from that place and Nagarjuna Konda is there, Nagarjuna Sagar, and we regularly use the Rasoshadas there. So one of the important Rasoshadas which we regularly use for the young diabetics, young onset diabetics, Vasant Kusmakar is regularly used by us. Vasant Kusmakar is one of the drugs of choices, especially in Prameha. But how I use? I use to the patient once in 3 months, 10 days, Vasant Kusmakar Rasar given. That means it has to be taken in a very small, this is a 100 mg dose. It has to be made into the paste, add some ghritam and thailam, and then it has to be taken in the morning on empty stomach for 10 days. Then we ask them to take again after 3 months. Once in 3 months, 10 days of Vasant Kusmakarasa is going to improve their quality of life and longevity of life and minimize the complications of diabetes. If they are on insulin, the insulin dose can be reduce it further, but if they take the Vasant Kusmakaras, but regularly I do not use for months together, but 10 days with a gap of around uh, 3 months. Regularly, this can be used, but we can monitor the creatinine and blood urea. None of the patients having any rise of the creatinine and blood urea. Already they are CKD. In that condition, we do not give. But even the patients who are taking the Vasant Kusmakra during the CKD period, I verified them. Their parameters are not much deteriorated. Mahalakshmi Las Ras is also another, because this is widely used for the Pratishaya, Kasa, Swasa, but ultimately this is a best Vajikanda drug. If you see that Mahalakshmi Las Ras is also, especially if the patient is not having any diabetes, but having the issues of uh, premature ejaculation or erectile dysfunction, both these conditions, where I used to give the Mahalakshmi Vilas Ras with the Jati Paladi Churnam. Jati Paladi Churnam is taken and Mahalakshmi Vilas Ras 5 grams, which are mixed with the 30 grams of Jati Paladi Churnam, which can be taken regularly for about 1 month. So this is what another Mahalakshmi Vilas Ras, actually here he says, so there is an exaggerated expression here. Bhagavan Lakshanarishu Vallabha. This is what he says. But this type of expressions are there commonly in Rasaushdas. That shows that there is efficacy, but practically not all. But some of the medicines are still effective. And they are, but very important thing in Rasaushdas, sir, you have to select from the good company. That is very important. On the stage, I cannot say from which company it has to be prescribed. So Siddha Makaradhvaja is also another. Siddha Makaradhvaja, I came across recently one professor from America. He was prescribed Siddha Makaradhvaja. He was taking around 3 months continuously, and his erectile dysfunction and premature ejaculation were corrected. So then I verified the urinary that is blood creatinine and urea. Nothing was happened to them. So that there is a possibility, because we have apprehensions, but if it is properly prepared, nothing is going to happen. Because Siddha Makaradhvaja, there was a publication you can see in the Google search, Makaradhvaja, a micronutrient mercury, which was published from one of the IAS officers of West Bengal. He hails from a Kaviraj family. That means his forefathers were Vaidhyas, Ayurveda Vaidhyas. He became the civil servant, and after retirement, he wanted to do some contribution to the Ayurveda. So he started a laboratory in his home and engaged the base scientist, and he started experimenting on Makaradhvaja, which was published by AVP. If you find that book, you can just purchase that. Makaradhvaja, a micronutrient mercury, published by him. So what he says that he fed to the different rat models, that means control, and different doses of Makaradhvaja fed to the different groups of rats. Finally, they were biological, that means hematological assessment was done, and histopathological assessment was also done after sacrificing them. He finally identified that there are no deleterious effects of Makaradhvaja on animal model, of any on the vital organs of the animal. That was one. And no plasma Makaradhvaja was identified. That was another important thing. Another important thing is whatever that the Makaradhvaja fed was eliminated in the fecal matter. This is also another important issue. And then finally, all the Makaradhvaja fed, though it eliminated through the fecal matter, biological parameters are markedly improved. Immunological parameters were improved in the rat model. So that means he identified that there must be some triggering factor, that is enterogenous stimulation is given by these micronutrients, which are triggering reactions from the intestines and having the systemic effects on the body. That was conclusion. You can just go through that Makaradhvaja micronutrient mercury, because I experiment more with the Rasaushdas. That is the reason I am sharing with this. Amrit Ballat Kilage manufactured by the PAPs because this is actually dealt in the Yoga Ratnakara, Vajikarana Adhikara. Vajikarana Adhikara, Yoga Ratnakara, it is mentioned. It is one of the important medicines which I prescribe for my patients in different conditions. But one of the conditions is infertility. This most effective rasayana in many autoimmune diseases. Patient compliance is good, potent therapeutic effect and safe for longer use, effective in stopping the progression of the autoimmune disease. Immunomodulatory effect is proved in clinical practice. And you can see here, the important thing is 1/4 of the quantity of the compound, all these is processed. That means 3/4 is Ballataki, 1/4 is rest of the medicines. Around 37 herbs are there along with Ballataki. So this is the compound preparation. Why I say is, I experimented upon this primary infertility in males and primary amenorrhea in females. Amenorrhea conditions, we used to get set cases where primary amenorrhea or secondary amenorrhea. Secondary amenorrhea, maybe 6 months back, they got the period and not coming. 1 year, 1.5 year, people also come. Once you start giving Amrit Ballataki, the periods are restored. So this is a very, very remarkable medicine, which I experimented on my mother also, having sudden voice loss. I explored what was the reason for that. Reason was vocal cord paralyzation. Why vocal cords were paralyzed? Then we took a MRI of the thoracic cavity. There was a lesion in the very close to the aorta, which was compressing the recurrent laryngeal nerve. Ultimately, it was of the vocal cords, and voice was lost. Then I went to Dr. CT surgeon, who was very close to me. He said that at the 86, why should we do surgery even for biopsy? It must be either usually malignant, less chance of tuberculosis. Then I started giving Amrit Ballataki. After 6 months, her voice was restored at the age of 86. And immediately, out of interest, I went to MRI. The lesion was also compressed. That means it was disappeared. And recurrent laryngeal nerve compression was relieved and vocal cords are restored to. She survived up to 96 years, but her voice was normal till then. So then I experimented on several conditions, even neoplasms, different types of neoplasms. I experimented this Amrit Ballataki, this very remarkable medicine, which you must remember. Motor neuron disease is another challenging disease. And there you remember the Amrit Ballataki. And alopecia. So complete alopecia totalis universalis or alopecia areata, the recurrence of lesions are commonly coming. There also, alopecia, vitiligo also, the lesions will be recurrent. There also Amrit Ballataki is one of the important. So these two drugs are Labub Kabir, probably it is Unani medicine, but widely used by all doctors. Labub Kabir is a Chataka Mamsa is there in it. Chataka Mamsa. So this is also more aphrodisiac, widely used. It's a very expensive drug also. It is costing around 3,000 rupees, 250 grams, 3,000 rupees. But I do not know from where they get the sparrows. Sparrows are now extinct almost, not visible anywhere, but they prepare it. So, and another drugs which regularly used by me is Pushpadhanvarasa, Kamini Vidravanras. Pushpadhanvarasa is Pushpadhanvarasa, Kamini Vidravanras. Kamini Vidravanras is very effective in premature ejaculation. The premature ejaculation conditions, if you give for about 30 to 40 days, followed by milk, that will be effective. You can just find the result. And because many students used to ask me, what are the drugs, sir, which they need immediate relief. So that immediate relief can be expected by Pushpadhanva and Kamini Vidravanras. And Shilajit, if you get a diabetic patient, don't forget to give Shilajit for him as a rasayana. Let him take throughout his life. His quality of sexual life is improved. And minimizing the effects of diabetes complications is also very important area. Shilajit, widely used by me for even long uses. Long uses means even coronary artery disease conditions, secondary prevention of the coronary artery disease, because after the bypass surgery and peripheral arterial disorders, all these conditions. But at the same time, this is very good for the increasing libido and erection problems, erectile dysfunction, and premature ejaculation. But this is very importantly effective in increasing the libido, even for the male and for female. Both can be used. But nowadays, lot of things are added for the Shilajit. Don't go for that. Only you give the Shuddha Shilajit. There are a lot of things. Now you go for the Shilajit. If you prescribe Shilajit, lot of Shilajit products are available, which containing lot of things, Vangavasma and the other things also. But that is not it. So next is Amalaki. Amalakam Vayastapananam. This is, of course, Amalaki Rasayana is anti-aging project was taken up by the science and technology. And actually, I was also one of the monitoring committee members. And Gopinathan, Professor Gopinathan, he was Professor Gopinathan, cell biology, molecular biology head from Indian Institute of Science, Bangalore. MS Valiathan probably might be knowing him. So who wrote the books, 3 books, Charaka, Sustrita, and Vagbata Legacies, which was published by Orient Longman. He was basically a Padma Vibhushan Awardee and cardiothoracic surgeon and turned Ayurvedic physician. He learned Ayurveda from a guru, Moose family in Kerala. 6 months doing the apprenticeship there, regularly going there, listening to him, and then coming back and going through that. So, so why I put this is biological effects of Amalaki Rasayana in Drosophila melanogaster model, because Drosophila is a fly. This is an American fly. This is a very important model for identifying the longevity of the life of the patient. Because Vayastapanam, it is said, Rasayana is one of the qualities is Dirghamayu. So usually this lifespan of the Drosophila melanogaster is 36 days. After using the Amalaki Rasayana, it survived 42 days. If it is projected to the human life, it's around 14 years are added to life if we regularly use the Amalaki. But we do not, because somebody told Amalaki is, somebody is saying regularly Amalaki is prescribed. You are saying that in the morning, some fertility center is regularly prescribing the Amalaki. That is true, but we do not trust in it. We have a lot of, actually around 13, 14 published papers are there in international journals. You just go through that Amalaki Rasayana on human model, rat model, and drone model. So that project was around 20 crores worth project, stretched for about 5 to 6 years, funded by science and technology, not Ayush. It was done by base scientists only. So now, why I want to say here is appropriate dose for fruit flies determined at 0.6% of Amalaki Rasayana supplemented food. No attempt made to isolate active principle from Amalaki Rasayana, as this approach has been unrewarding, because the directly Amalaki Rasayana is prepared by Amalaki powder, Bhavana with Amalaki Swarasa for 21 times, which was manufactured by Kottakkal Ayurveda Pharmacy. Aryavaidyashala has contributed for the manufacturing of this product. So now, larvae fed on Amalaki Rasayana supplemented food show earlier preparation by few hours. Early preparation, early growth is taken place. Salivary glands of larvae fed on Amalaki Rasayana supplemented food showed significant increase in size of compared to controls, and significant increase in the total hatched eggs in female flies. This is also very important. Hatching is also increased. Supplemented food showing increase in fecundity, that I will show you here. You can see here the median preparation is control group 116 hours and honey plus ghee, because Amalaki Rasayana was given along with unequal quantities of honey and ghee. So there we need a control also. Honey ghee can also be effective. So that is the reason we removed the honey ghee effect also. Honey ghee was also supplemented to one group, and Amalaki Rasayana with honey and ghee unequal quantities is given. 112 median preparation time is reduced to 4 hours, and 236 is the eclosion. Pupation is called, that is becoming pupa from the eggs. and act of emerging from the pupal case to the eclosion, that is coming out a worm, is a eclosion. So eclosion time and pupation time are reduced significantly by Amaliki Rasa. So now you can see here, but here this is Rasindura actually. They conducted on Rasindura also. That is the reason always means Rasindura. Control group, Amaliki Rasayan fed, Rasindura fed. So here you can see the fecundity of larvae and dead flies. This is in programs. This is actually the lifespan, medium lifespan days is 40 days, 4 days added. And if you take into the human consideration, around 4 plus 2, around 36 days, 3. 12 years lifespan can be expected if you project the. So now coming to the end, Atmaja Bhava are also there. That is unexplained infertility, because in spite of your effort, in spite of your Panchakarma therapies, by giving medication or by going to the temples, but we do not know. So what? Because I remember engineering college professor who came to me for Vicharchika, which was treated by several dermatologists earlier. He came to me and just I have come through the Ashtanga Hridaya. There the Abhishekam is advised, Rudrabhishekam is advised. And I told him he was a computer engineer, professor of computer engineering head, and also he was working in SP University, engineering. And I slowly said, sir, can you do the Rudrabhishekam? Yes, why can't? If you say, I will do. But this is a part of treatment, sir. We used to, because we forgot the Daivapastra Chikitsas. He went there after 15 20 days. There is a remarkable reduction in the skin conditions. Sometimes the things which are Daivapastra, Daivam Adrustam ya Purvajanma Krita Karmam, that has to be ameliorated, which can be, because now earlier it was there, but now it is completely delinked from the Ayurveda. It has become a part of astrologists or other people, and now it's only free from the secularist aspects. So Daivapastra Chikitsa is also very important. Now, the important thing which I want to say is Sadhya assessment. If some problems are there, then we need not do anything. Structural problems have to be carefully identified. All the infertile couple, and you have to select which infertile couple. Counseling done based on the diagnosis. Try to interpret 7 analysis reports on Ayurvedic lines, what she further rightly said. So then, as per the requirement, select drugs as per the conditions. So this is what actually I want to stress. But whenever the infertility come, I never see isolated. You remember, if male comes, male infertility, I do not treat only male. I'll give treatment to the female also, because we do not know what are the factors involved there. And if a female patient come with infertility, I give to the male also. So couple infertility management is the right way of treating the infertility, addressing the infertility conditions, not the isolated ones. Because that is the aspect of the modern system, but not our aspect. We see the broad way that we have to correct the lifestyle, correct the sleeping habits, correct the emotional disturbances, adding yoga or pranayama for their lifestyle, and regulating their food habits. And all these also part of the treatment. Remember, just simply give Shodhana or Vasti or giving a treatment is not sufficient. But you have to address the other factors, lifestyle corrections also. Then only will be successful for treating the infertility conditions. Thank you. Thank you, Anita.
Thank you for this wonderful session, sir. Now I request Dr. Maruti Guri sir and Dr. Vastrit sir to felicitate Dr. Murli Mishra. Now we will move to the next session. I request Dr. Vashtra sir to be the chairperson for this session. Now I request Dr. Madhavi Guri sir to raise the dais. Good afternoon, everyone. It is my immense privilege and honor to stand before you today and introduce a very distinguished figure in the field of Ayurveda, Professor and HOD Dr. Madhavi Guri sir, a person whose dedication to the advancement of Ayurvedic medicine and education has left an indelible mark on the Ayurvedic community and beyond. Dr. Guri sir is a highly accomplished medical professional with an extensive his unwavering commitment to Ayurveda, with a specific focus on Kaya Chikitsa and andrology, has benefited over 155,000 patients. His clinical work is deeply rooted in scientific evidence-based Ayurvedic treatments, making him leading authority in his fields of expertise. Dr. Rigavi sir completed his MD in Ayurveda from the prestigious Gujarat Ayurveda University Jamnagar in 1998. During his studies, he specialized in andrology and reproductive medicine under the mentorship of revered experts such as Padma Shri Professor Gurdeep Singh and Professor G.S. Acharya. His work in male infertility, reproductive health, and chronic diseases continues to be pioneering, particularly in the currently, he is serving as a professor and HOD of Department in Postgraduate Studies in Chikinsa and Andrology at the Tarana Government Ayurvedic Medical College and Hospital in Ballari, Karnataka. Under his visionary leadership, the institution has flourished with significant advancement in both academic and clinical excellence. He has delivered over 155 guest lecturers and participated in 15 TV and radio programs, sharing his extensive knowledge and experience with audiences far and wide. His work has influenced not just students but also professionals, making him an important figure in the community. Dr. Digavi sir has also been a driving force in research with numerous studies published on topics ranging from male infertility. In addition to his extensive professional achievements, he has mentored numerous postgraduate scholars and guided a variety of clinical research projects in the field of Chikinsa and andrology. Over to you, sir.
So, good afternoon. Thank you, Dr. Sangeeta, for elaborate introduction of mine. Ragadi Rogan, Sadatani Shaptani, Asesha Kaya Prasasani Sesha, Autsukya Moha Radidan Jagata, Slow Apuro Vaidya Namastataslo. Great salutes to the respected chairperson of the session, Dr. J. Vashtra sir, our chairperson. Actually, me, Swarda, and Dr. Murli Krishna sir, we are all working on NCSM syllabus committee where sir is heading all the Kaya Chikitsa, Rasayan Vajikar and Manas Yoga sectors. Respected faculty members, and my dear delegates and students. Actually, I don't want to take a long talk. But fortunately, Murali Krishna sir has saved 30 minutes for this before lunch. So I thought of finishing my presentation. After lunch is very difficult. And I hope you all will hear 20 or 30 minutes. My aim of taking this session is to encourage new postgraduates of Kachikitsa, Rasayana Vajikarana or any other postgraduate scholar to come up with a andrology lab, Vajikarana lab. In that intention, this session is kept. Neither this is a clinical study, nor enormous medicines will be told to you as we expect. Usually, PG scholars will expect some medicines. Professor Murali Krishna sir has given a lot of clinical material, medicines. We have three more sessions in the afternoon session where three Rasayana Vajikarana specialists they will tell their clinical material. That will be also very interesting for you. Immediately after the lunch, we'll go to the OT where we will demonstrate to uttarabasti. There are two OTs. In each OT, three or four delegates can come and you can easily see the uttarabasti procedure. And after learning that, we'll come back with again scientific sessions will come up. Then panel discussion, interaction, question answers, or any questions related to this session. Later on, we'll end up with valedictory session. Are you ready? Delegates, are you bored? Looking tired? You have taken two sessions of Vajikarana pills now. You are all young and energetic horses now. So establishing a endocrine or andrology lab is very interesting. And don't be more ambiguity that Tarnath College they have done very good thing. KLE University they have done good thing. It had not happened in one day. It took 3 decades to establish one such unit in the government sector. Actually, KLE is a huge university where they can do miracles because it is a different environment. But in a government setup, many of the postgraduates from government college are there. So it is very difficult to establish such a establishment. For that purpose, we have one interesting quotation: enter to learn and come out to serve. This is the standard tagline of Tarnath Ayurveda College. So today, this is applicable to you also. You have entered this hall and you come out with a service motto. If you just hear participation, very good food, very good organizing committee, and you'll get a very good certificate, that's not the purpose. You once you go out, you should come out to the humanitarian service sector. See, in future you'll not get government job. You may be telling Murali Krishna sir, why he became retired is he want to have a very good practice and college administration principal post was a hurdle for him. So he resigned from the post and he is now full-time practitioner. Actually, today he gave a lot of secrets. I don't know how many of you catched it. There were very good six hit by him, and all are very secret things he is openly telling. Normally, you don't get such speakers. He's such an honest, down to earth man. What is his loss is today I know how much he lost. Yesterday up to 8:30 p.m. he practiced, and by 9:10 he took a train and came to Bellary. And such a pure Ayurvedic practitioner, since 20 years I am seeing him. We met in many conferences, but now to the practice of the private sector in Kachikitsa, general Kachikitsa practice, he left principal post. That is the moral for us. If you want to flourish, don't stick on to government job. Understand? If you are in government job, you may be asking, I am in government job, so I am doing all Vajikarana, establishing all. It is easy for us. But as a private practitioner, establishing a andrology lab is very difficult. It is not easy. You have to invest not only the money, your brain, your time. So for that purpose, I have taken a task of how to establish an andrology lab. One interesting thing for you. Now, Uttarabasti is very interesting. We'll show you in the afternoon. People are not ready to come to government hospital free of cost, and our PG scholars prepare wonderful medicines. The Tilataila in our PG Kachikitsa department is not purchased. We purchase black sesame, 1 quintal we'll purchase. We go to cold compression oil extractor, we take oil, then that will be subjected to murchana and wood fire is used. Now our PG scholars have stopped using gas stove. One is gas stove is costlier, wood fire is very cheap, and it is more Ayurvedic touch. And after the Taila Murchana, we prepare actually Samskarita Sneha. And they prepare medicines and then they do clinical trial. That's why Tarnath Government Ayurvedic College is substantially producing extensive positive results. And in the name of Tilataila in the market, everything is sold. 85 rupees per liter and 550 rupees per liter is also available, and all are not exactly Tilataila. 550 rupees per liter is also not exact Tilataila. And once our students are preparing, it costs about 800 rupees per liter. It costs about 800 rupees per liter. That is going to work. With this, there is a question that even government hospital people are not ready to come for 3 days uttarabasti course. They don't have time. For that purpose, now there is a new trend. In metros, home insemination process is there. Very interesting concept. Uttarabasti at home. Auto uttarabasti therapy. Understand? We will show you doctor doing uttarabasti, but public is doing auto uttarabasti. If you are suffering from erectile dysfunction, husband cannot post the shukra high up in the vagina. So they will suffer with infertility. So when husband is having erectile dysfunction, what is the new trend is you can go for I conceive. A kit is available, very economically available, and you can inject your semen into the higher vagina and you get conceived. I conceive at home is a self-insemination IUI kit. And just you see the cost is very simple cost. It is comfortable design. And now people are interested in freedom. In Karnataka, in Bellary, concept of marriage is going up. Now concept of marriage is outdated because female are better than male. See, female are getting MD seats more than boys, and female are getting more jobs, and female are getting good practice also. So they don't want husband now, but they want to conceive. Then it is a comfortable design, sterilized application. It is very sterile. Husband is not always sterile. Understand? Husband goes to see one of the risk factor in flights. All air buses are viral loaded buses. Our flights are infected. All flights, domestic or international. It looks clean. Air hostess looks clean, but the toilets in the air flight is highly contaminated. So this auto insemination kit is sterilized and very safe, and we give expert guidance also. See, the product is given, expert will give guidance. So this is the best way of conception. This kit is very simple. One of the interesting is auto insemination is needed in the current practices because success rate is very down. 20% success rate is expected in all art, mart, etc. So if erectile dysfunction husband is there, they should come to Tarnath College or KLE Hospital, and they have to undergo a lot of detoxification process, Shodhana, Rasayana, Uttarabasti, Vajikarana. This much time is not there. Male patient will not come for this much. So, struggling for erectile dysfunction, more than 30% of the males are suffering from ED. I have an experience. We give one chart for a couple. We tell that this is the fertile period of your wife. You must put holiday or leave on that day and you should meet. If you do intercourse on that day, you will get conceived. What I have observed is when I give the date, 21st March is the fertile period for you. Ovulation has taken place, egg is released. You do intercourse on this day. On that day, husband will get erectile dysfunction. Definitely, it is anxiety causing erectile dysfunction. Then this I conceive kit is very effective in female for infertility. If premature ejaculation is there, yes, many PG scholars are working on that. Sir has given a good medicine for that. But still, premature ejaculation is more of psychosomatic. More of psychosomatic, even with ambiguity, anxiety, and female is always guiding. See, today doctor has given date 21st. You come earlier from the college. Tarnath College principal is very strict. HOD is very bad, right? You don't get leave, and more work will be given on your expected day. You are ready to go today, but Principal will give you more work on that day. Then what is the solution? Auto insemination kit. 40% of the male are suffering with premature ejaculation, struggling with vaginismus. Even female are also having problem. In vaginismus, she will not have a normal intercourse. She will not have very good reproductive intercourse. Then also this insemination kit is very effective. Sometimes same sex people will get marriage. Now Supreme Court is working on this. Two female is accepted, but how the auto insemination kit is there? So step one, collect in a very good container. Step two, there is a very good adapter, very safe, no risk at all. Fill the applicator with the semen, then insert into the vagina, high up in the vagina. Very simple process. It should be done at the night. Female should sleep for 6 to 8 hours. Conception rate is there. So now coming to this current practice, apatya santanakaram is Vajikarana's one of the beautiful quotation in Charaka Samhita. And Chakrapani comments very beautiful on this. What is apatya santanakaram? Apatya means child, santana means child. Apatya santanakaram means what? Apatya santanakaram is one who takes Vajikarana therapy and conceives. Putra pautraschapi Vajikarana anubhavam. Once the couple take Vajikarana, they conceive, the son, grandson, and grandson will also have Vajikarana effect. That is apatya santanakaram. I have very good patients. They say, sir, you are very great doctor because government hospital, free medicine, free treatment. Very good, sir. Why I am very good? Sir, you gave medicine for my first boy, but without medicine also I got next two conceptions. One Vajikarana treatment, second 1+2 offer, 1+1 offer. That is the importance of apatya santanakaram. Then fertility, male infertility, subfertility, andrology, reproductive medicine, eugenics, epigenetics, all these things are very easy. Now you want to establish a andrology lab and Vajikarana lab. These many steps are there. Actually, we are not included in the syllabus. In the syllabus, only one point is there: how to establish a andrology lab, Vajikarana lab. This is there for Rasayana Vajikarana PGs. But I have calculated these many steps are there. I'll end my talk by explaining all these steps within 10 minutes. It is not any boring thing. Firstly, you should have a front office. See, Vajikarana front office should be like this. Understand? You keep a very good front office. Vajikarana like front office. You understand that? See, he is going out, you bring this. Then your Vajikarana clinic will be very well established. And history taking, in male system, it is very difficult. You tell anything, they will tell, yes, sir. You are very good with sex? Yes, sir. You are having very good sex act? Yes, sir. You are not missing a fertile period? No, sir, I will not miss. Everything they tell. झूठ ज्यादा बोलते हैं. Understand? प्यार में चलता है, but fertility में no. Practice and theory is very difficult. You should become, see, for example, I was a very innocent, honest, I was very thin when I was a first year MD scholar, very thin boy. And when I went to Vajikarana setup in Jamnagar, and I should speak in Gujarati, also I should speak all vulgar things. I started reading pornographies, I started reading all fantasy books and all. And when the patient comes, talking all below the belt level, all the nonsense things we have to talk. Then what is the thing is, examining or asking the question to the male patient is very difficult. It is to take information is not so easy. Dr. Swarada has given a beautiful protocol to fill that is not a one-day job. Minimum 5 years you should get experience. And within 3 months or 6 months, you have to finish your PG protocol and you should get acquainted with all these languages, vulgar language. This is a blue light area, red light area, Vajikarana department. A PG scholar should speak very comfortably without any vulgarness. That is the technique. So you practice with your theory, whatever you read, whatever you understand, you experience with a better examination center. This is our Vajikarana Labs history taking section, where semen collection one room is there. We give semen collection in Jamnagar. What we have to do is, B.S. Prasad sir and we all, through Bombay, we should go to Jamnagar. We used to collect all porn pictures, all porn photographs, and we used to keep in the semen collection lab. And gradually the photographs are missing. Every patient goes inside and takes some photographs and goes out. And we used to bring again and again. And this was not known to Gurudev Singh sir. Our guide was not knowing all these things. And now, for collecting a semen sample, there is a beautiful audio visual setup is made. This is sperm is collected, semen is collected by a male, and this is not by a human being. This is a dog semen collection technique. This is only for your information. Dogs are kept with the condom and then semen is collected. In animal husbandry, they do that. This is male systemic examination room is there. One peaceful examination section is needed, and this is CASA semen analysis lab, where it is a phase contrast microscope, and you can operate and understand with a software. You will get a better clinical analysis of this semen. And whenever you are doing semen analysis lab, all precautions must be taken. Our seniors will give chart to junior, and junior doing this. Mr. Amresh, one of my student, he is doing this. And you can see, you can see the sperms are moving here. The motility is calculated. Rapid linear progressive is straightly running. Who runs very straightly, he will win the race. The sperm which is straightly going will be rapid linear progressive. Slow linear progressive is it's not speed. And rapid linear progressive, and this is actually oligospermia patient, and this is a very good normal sperm count patient. Understand? Automatically, CASA gives you the report. You need not worry. We used to do manual calculation. This is, you see, very good normal normospermia patients. Sam. Next one. Next one. So you have to do, if you do, this is a sperm meter. We are using sperm meter. We can use double microscope, binocular microscope to calculate semen, semen warmers, and centrifuging machine, and accessories. All these things are required for establishing a semen analysis lab. These are all visitors. NCSM visitor have come. See, whenever NCSM visitor comes to our college, B.S. Prasad sir will tell, when you go to Bellary, see that andrology lab and come. So all this is not as a part of NCSM. Andrology lab is not needed. We are better than NCSM norms. When they see these visitor, the recent NCSM visitor from the Lucknow, he was also very happy to see that. Reto Pariksha was very well explained in the morning. When semen is collected in a petri dish, it is like this, coagulated. Then when it is having a liquefaction, then we can count this pump. Unliquefied semen, we cannot count this pump. When it is liquefied, it is very easy to count this pump. If it is unliquefied, it is Kafaja Shukradrushti. One of the best drug is Ashwagandha. Ashwagandha 10 grams twice a day with plain water has been done in a PhD research work. It has shown that Ashwagandha liquefies very well and also improves the Kafaja Shukradrushti Lakshana. Ashwagandha is misused by most of the pharma companies. I'm sorry to say that. You have a lot of 4-5 people are there in the ground floor. You can see them. Some of them have given you the samples. Pharma companies use all the Ayurvedic drugs in their own way, but they never do scientific research in Ayurveda. Whereas in modern research, they put lot of crores of money. But in Ayurveda, nothing is there. Ayurveda can do anything. Ashwagandha will do anything. But Ashwagandha is effective in Kafaja Shukradrushti when it is given with warm water. When it is given with milk, it is going to decrease the Vata Shukradrushti. So, Panchakarma Shodhana was told the much better Shodhana Chikitsa in Rasayana Vajikarna is Virechana, Basti, Nasya. These three are very important. Without Virechana, if you do Basti, no shortcuts for success. If you do any shortcuts, success rate is limited. So, one of the best Shodhana Panchakarma sector is needed for establishing an andrology lab. Now you are understanding establishing an andrology lab is not one microscope and one small room. This is a huge complex. 3-story building is required for all these things, where you can get sufficient place where patient will relax. Psycho, neuro, immuno, endocrinal relaxation is needed before uttarabasti. There is a saying that I accept with Dr. B.S. Prasad, direct uttarabasti has no relevance at all. I have done 30 years, it took time to understand that if you do uttarabasti directly, there is no much encouraging result. From Jamnagar time I am telling. But now, in 8 years, what I learned is my PG scholars are my teachers. What they taught me is if they do all these protocol properly, collecting tila and then Tilataila, Taila Murchana, then drug. Only Murchita Tilataila Snehapana, Murchita Tilataila Basti, Murchita Tilataila uttarabasti is 100% effective. Not only I am telling 99%. There is raw material problem for Ayurvedic people. If only Murchita Tilataila is effective, Kshirabala Taila, Mahashabala Taila, so many Tailas we have tried in uttarabasti. There were limited result, 25% was correct. But when we changed the protocol, when we changed the approach, the university says group A, group B, do one clinical trial, 30 patients, 15, 15. Out of them, 30% very good result, 30% moderate, and 10% no result. This is not going to work in Ayurveda. A vertical research is required, and there is a longitudinal research is required. Longitudinal research, my friend from Kerala, Prakash Mangalasari, is no more now. My junior, he expired. We were talking in Kollam Beach. Where is it, sir? Longitudinal research is the only research for Ayurveda. But unfortunately, university curriculum is take group A and group B. Group A is better than group B. Group B is better than group A. Both are equal. This is not going to work with Ayurveda. You start with Deepana, Pachana, Rukshana, and self-prepared medicine in PG research, self-prepared medicine in practice. Prepare and practice is the Moola mantra for Ayurvedic future. Next 20 years, you can run your show if you have a raw material with you, right drug with you. Then even Murchita Tilataila alone is enough. I don't require now Shatavari Gruta, Ashwagandha Taila. Nothing is required. Purest form of Murchita Taila, one of the clinical trial with Pramod, he will be telling in the afternoon. Penile artery which was blocked was treated with uttarabasti with Murchita Telatailam, and we have seen that penile artery block is reversed. The document is done, and based on that, Rajiv Gandhi University has granted 10 lakhs for research project to me in this college. So this is possible when you have a better Vajikarana lab or enterology lab, and where you are working in this lab. And what is my dream is Trigarbakuti. Recently, we were talking about Kerala's Trigarbakuti, where T. Pravishika Rasayana was talked about. Uttarabasti OT should be Trigarbakuti. Panchakarma OT should be Trigarbakuti. Then you will get more expected results. If you are doing in an open air theater, if you are doing in an open air room, results are coming. But if you do Trigarbakuti as OT for Uttarabasti and Trigarbakuti for Panchakarma, then we may get better results. So what is your enderology establishment? One Trigarbakuti should be there for OT, for Uttarabasti. And this is the inner side of Trigarbakuti where the areas are very well planned. If this, you can see color combination, ambience. If it is like this, even though in Uttarabasti we will put one eye covering to the patient, but he should have a very good ambience, and Uttarabasti OT should be like this. Male Uttarabasti can be done in very simple procedure. 150 ml dispo van is needed, 4 to 6 mm rubber catheter is needed, and a simple local surgical cleaning techniques. So with this, Purva Karma is patient should be subjected to perfect Virechana, and then one Karma Basti. Actually, one Virechana Karma takes 11 to 12 days. 5 to 7 days Snehapana is needed. Actually, 30, 60, 90 ml is wrong. Snehapana should be done until Samyak Snigdha Lakshmi. For Shukradhara Kala, the medicine reaches on the 8th day. So you should give 7 days Snehapana, then 3 days Vishrama Kala and Virechana. Then 9 days gap, and if you do Karma Basti, to reach to Shukradhara Kala, 16 Anuvasana is needed. The Basti which is given for 16 Anuvasana is Karma Basti. After Karma Basti, if you give Uttara Basti, then Purva Karma for Uttara Basti is all these things. Patient should be given Snigdam, Swinnam, Prashitilasayam, Yavagum, Sagrita Kshiram, Pitavantam, Yathabalam. See, we should give Yavagu before Uttara Basti. With Gruta, you should be given. And then Purva Karma, Bhojet, Paisa, Matram, Yushena, Athava, Mamsa Rasenava. Before Uttara Basti, see, it is not simple going and putting catheter and injecting 30 ml of Sneha. It is Anena Vidina Dadya, 3 Chaturopiva. Either 3 days Uttarabasti or 4 days Uttarabasti can be given. And Purvam Shalakaya and Vishatovai. Shalaka, what we are using, we are not using Rajata Shalakam. We are not using Swarna Shalakam. We are using rubber Shalakam because it will reduce the trauma to the urethral membrane. And after all the precautions, a catheter is inserted and very slow process. When you are going to the OT, one interesting thing we have observed, sir. Government of India has said that MBBS house surgeon will be posted to Ayurvedic hospital. In our college, it is happening. Medical college internees are coming to Tarnath College for 1 week posting. Fortunately, one of the female internee from medical college, she came. We are doing uttarabasti. We showed one patient. She is very brilliant. Second patient, she did male uttarabasti. By seeing one patient, they can do uttarabasti. And you are seeing again today one uttarabasti you are seeing, you can do that. By second patient, you can perform. But your hand should be so gentle, so slow. If you do any quick activity, it will cause trauma to the membrane. So it should be very slow, and catheter will go to the external urethral meatus, then it passes to the bladder, and we are doing uttarabasti in two methods. One is intravesical uttarabasti, intrapenile uttarabasti, and intravesical uttarabasti. Intravesical uttarabasti is ultrasound guided. Seminal vesicle should be injected. So that is very difficult. That's why Acharya says in a sitting posture uttarabasti should be done. We have done that. Is it possible that in front of a male doctor, male patient getting erection, in sitting posture he should get erection, in the erected penis only uttarabasti is told. But we are not doing all the time. But we did in our OT. One of my PG scholar, Dr. Chaitanya, she was doing Rashastra PG. She did this uttarabasti because the patient was comfortable. He was an army man. He got erection. He was sitting, and we did in sitting posture uttarabasti only. But this is all possible when you convince the patient. And 12 angulas uttarabasti netra pramana is there. What we insert to the intravesical uttarabasti is 12 angulas. So a scale is shown for 12 angulas uttarabasti. Paschat karma is tatat pratyagata sneham aparanne vichakshanaha bhojet payasam matram yushena mamsa rasena va. Before uttarabasti mamsarasa, after uttarabasti mamsarasa, but Ayurveda is projected as herbal medicine. See, before uttarabasti mamsarasa, after uttarabasti mamsarasa, and we are projecting Ayurveda as herbal medicine. Ayurveda is not a herbal medicine. All panchakarma procedure requires mamsarasa prayoga. And you see, all in Siddhisthana and Kalpasthana, all Shukrakara bastis contain mamsarasa, all Siddha Yapana bastis. So this is the normal technique what we follow. A small video we are showing, a 2 minutes clipping, where firstly all sterile methods are taken. Then patient is comfortably sleeping supine position. It is easy for uttarabasti. Sitting, once you are expert, you can do that. One assistant is needed and one performer is needed. 4 mm rubber. This is a small catheter where feeding tube we have taken because the penile urethra was very thin. So I have taken a feeding tube, and through this we are not using any anesthetic gel. The same thyla what we are using, we are dipping and we are giving. So slowly it is passed. Can you guess who is doing? Huh? Who is doing this? Slowly we are pushing, and take some 2.5 minutes time to pass the catheter through the urethra. That is actually the best time to give a safe uttarabasti is 2.5 minutes time is required to pass the catheter. See, slowly you are pushing sneha also so that local lubrication takes place. And urethral membrane also absorbs. We inject the oil at the urethral membrane, external urethral meatus, prostatic urethra, then goes into the bladder. Throughout the passage, we push 1 ml, 2 ml of oil, and now it goes to the bladder. See, once it goes to the bladder, it will cause some pain. After that, catheter will not come back. It is staying in the bladder. See, it's not coming out. Other urethral meatus, the catheter will come back. And gentle push is enough to cross the external urethral meatus. Then inject 40 ml of sneha. 30 to 45 ml we take. One pala pramana is told. So in one of the standardization we did 10 ml to 250 ml we tried, but 40 to 45 ml gives normal result. Manu Sharma was my friend from Punjab. We did 10 ml uttarabasti before and after sperm count was taken. 220 ml uttarabasti before and after semen test was done. The results of 40 to 45 ml and 200 ml are same. So now it is injected. Slowly you are pushing inside. Sneha goes into the bladder. intravesical uttarabasti through bladder absorption is possible. One of the thing is in the bladder, if you put potash alum water, it will be in the autopsy noted that in the coronary arteries that was deposited. So uttarabasti, what you are pushing into the bladder, it will go to the heart. So Mutravega Dharana causes Hridroga. So the bladder uttarabasti will go to the Hridaya. From Vanena Rasadhaturi Vikshepochita Karmana Igovat Sarvato Jasram Dehe Vikshipate Sada systemic circulation, local absorption, local stimulation, neuroandrogenic stimulation, those receptors will be stimulated. So direct and mechanical stimulation will also cause improvement in uttarabasti. After 40 ml is slowly injected, that again takes also 2 to 2.5 minutes. Then the bladder injected uttarabasti, then we will take out the catheter. It comes out. So this will be demonstrated in a post-lunch session. So you take out the bladder, the catheter, it will be 12 angulas which has passed inside the male. There will be no pain, there will be no any complication, no side effect, nothing is happening if you follow the OT guidelines. The protocol is as per the OT only, we have to maintain the hygienic areas. The catheter is sterilized. The thyla gruta is also sterilized. We put it in the autoclave bin and it is sterilized. Slowly you should take out, otherwise trauma will cause inflammation, then infection. So afternoon, what is our plan is 2 operation theatres are there. 4 delegates can go to one OT and 4 delegates to another OT, and you can see the uttarabasti procedure. After coming out, 2 to 2.5 hours retention time is calculated. On average, 1.5 hours to 2.5 hours time retention time. After 2.5 hours, when patient passes the urine, the medicine will come out. Sometimes even it will take 3.5 hours, 5.5 hours time is also taken. After that, you see the thyla is not coming out. Then glans is closed, and in the abdomen, reverse abhyanga is done so that it will stay in the vasti area. In Chandogya Upanishad, one word comes. In Chandogya Upanishad, he says how fertilization takes place. After that, he says the area, what we are doing, Uttarabasti area, he says this is equivalent to the ocean. He says it is equivalent to ocean. In the bladder, all the fluid comes. So from all the rivers, water comes to the sea. In the same way, all the dhamanis and nadis will bring water to the bladder. So this is explained in Chandogya Upanishad. Vasti means kidney, ureters, bladder, and urethra. This area is compared in the Upanishad. So like this, Uttarabasti procedure is done. This is a male infertility counseling center where couples are counseled. And Vajikarana audio-visual setup should be there. Audio-visual, if you are 4 or 5 patients are there, you take them to audio-visual room and explain the concept. Stem cell and genetic lab is also needed. Because what we are doing in Uttarabasti is, Majja is also used in Uttarabasti. Our students are doing 5 ml of Majja is added into Kshirabala Thaila or Murchita Thaila and we are giving. That is stem cell research only. Majja contains stem cells, and that Majja Uttarabasti is also needed. So in that stem cell laboratory is expected. This is how conception takes place where MART is male assisted reproductive techniques. In artificial insemination, they collect the sample and they process it and then inject it. So one MART center is also needed, stem cell center is needed, sperm bank is needed. These are all very dreams of a government institute. To make a semen bank or sperm bank, lot of guidelines are there. So to make that sperm bank, why sperm bank is needed? Some people, what are the issue is, people say, I don't want to conceive now. At the age of 28 or 25, they don't want to conceive. They want to conceive at the age of 45. So that sperm of the age of 28 will be stored. When you are 45 plus, that egg or sperm can be taken out and IVF is done. So for that it is needed. For the use of upcoming fertility treatment cycles, in future whenever we are doing, individual planning for gender affirmation therapy, for that also sperm bank is needed. And male infertility, ethical and legal sector. When we are doing Rasayana Vajikarana syllabus, this is a huge risk area. You are telling stem cell, you are telling MART, you are telling artificial insemination, so many things we are telling. There are legal aspects. So many legal issues are there. Even for paracetamol, there is a huge problem in Karnataka. where we are not allowed to practice the modern medicine, and we are talking about high technology. That's why don't do modern cross practice. You take the technology and do Ayurvedic practice. We are using only microscope technology, and then you are doing Ayurvedic practice. You can do a lot of ethical and legal section should be there. One lawyer should be adopted in all Vajikarna lab. One lawyer must be there. Okay? In Vajikarna Museum, you should have one Vajikarna Museum in Andrology lab. This is Vajikarna Museum from Khajuraho. Acharya Jyotir Mitra from Banaras University, he came to Gujarat Arya University as an inspection committee member. He was a retired professor, and I was second year MD scholar. He asked, "You want to build any international center of Vajikarana?" Yes, sir. Where you want to construct? I said, wherever government says. No, you do Vajikarana International Center in Khajuraho temple's next place. And he asked another question. We were doing semen analysis. He asked, have you taken the sample of old man after 60, after 65, after 70? Have you done this semen analysis? We said, no, sir. No such patient came to our lab. No such person came to our lab. So we are not done. So these are the interesting things. You see, every temple contains sexual postures. You go to any old temple, in the main shrine, just left to that, backside there will be sexual postures. It is a common dictum in India that temples were sex education centers. That's why these sculptures are there in Beluru, Halebedu, or Khajuraho temple, Sun temple in Konark. These are all the Vajikarna museums. Vajikarna products. See, Vajikarna products, so many Vajikarna products are there. You should have collection of best Vajikarna medicine. So in your andrology lab, you should have collection of good quality products. Professor Dr. L. Nagireddy manufactures this Vajikarna Rasayan. This is very famous in Bellary. I was not knowing. When I was a contract basis lecturer, we were writing this medicine. But when I was a professor and HOD, I came to know that this is a popular medicine among the public of Bellary, that many people voluntarily use this Vajikarna Rasayan. It is a Leha preparation. It is Kapikachu Pradhana drug, where it is going to increase the sexual power and also the sperm count. Vajikarna Mitra Mandali. This is one of the beautiful concept of Kaya Chikitsa and Vajikarna by Charaka. He says, in your andrology lab, who should be there? One attender, one PG scholar, one doctor. No. Vajikarna Mitra Mandali is who are experts in Vajikarna. They should be in your team. They should be counseling people, technical people, non-technical people. Who knows Kama Sutra should be present in your Vajikarna Mitra Mandali. Surrogacy center. You should have a surrogacy center in your Vajikarna lab. Surrogacy center is erectile dysfunction patient will be given a surrogate partner. It is paid surrogate partner, and that surrogate partner will teach you how to do sexual activity, how to do premature ejaculation control and all. So surrogacy is one of the important aspects. Mallanaga Vatsayana, he says about all these things. I have seen some of the patients, they get premature ejaculation with wife. They don't get premature ejaculation with friend. Listen. So this is how these surrogacy centers are going to be established. Couple counseling center. You should have a couple counseling center. And if you cannot do all these things, sir, you are telling all these things, this is not possible, what to do? Then refer your case to Tarnath Government Ayurvedic College. Thank you all for your patience hearing. And I request Dr. G.R. Vastra sir to give comments for morning 3 sessions chairperson's remark.
First of all, I thank Dr. Madhav Dirgavi for extending invitation to me to be here on this day. Since my retirement, I am out of academic, almost out of the academic field, but I am forced to live with the service sector of the Ayurveda. The way the service sector is working on grounds, looking at that, I always deeply felt about the future of Ayurveda. Today morning only, after going one statement by the Government Doctors Association, I felt probably Ayurveda is not having future. But after hearing three speakers, I felt Ayurveda is having a better picture than what we have in all these days. I am the field of Ayurveda for almost 50 years, more than 50 years. I've seen the ups and downs of Ayurveda. I've seen the first days of Ayurveda. I've gone through all those days. Always aspired to see the Ayurveda in a better hands. Today, I feel after listening to the doctor, so the name is very not that popular. Usually, so just new name for me. So sorry for that. I was knowing about you since we used to be in contact with Mazadika. After hearing you, I thought our young generation, particularly people like you, are taking the Ayurveda to a higher level. Right? Because Ayurveda needs new look. We should not just bother about what our classics says, but whatever the classics have told on those days, particularly as Dr. Madhav Dikshit mentioned about 140, 40 ml of that age. Just imagine citing this 40 ml is the dose. Then Indra came to them, Brahma came to them and told them, this is the dose you just practice. You know, they have done a lot of research on those days. Just imagine the effort those people have put on those days when they had nothing. But now we have many things at our disposal. If we do not use all those things, then we are actually causing damage to the Ayurveda. That is why make modern, as correctly mentioned by Madhav, make modern technologies, use the modern information, that make Ayurveda better science than modern. That's the question. Right? Good. Sardar, I appreciate for the best presentation. Right? Because a lot of things you have covered, many points you have covered. Probably that maybe particularly your presentation is encouraging the our postgraduates. Was my feeling. Always I used to compare because I am always also modern people, modern experts are my good friends. I used to be with them and looking their performance after having a post-graduation, what they used to perform in the field. And comparing this to the Ayurvedic postgraduates, I used to feel very sorry why this situation is there with us. Then probably I thought, probably it's Ayurveda because of Ayurveda. But after listening to you, I feel yes, there is a possibility. If everybody try like you, probably Ayurveda is having a better future. It's not Ayurveda for you. Particularly, the postgraduates should have a respectable practice and respectful earning. That is what I want to see with my postgraduates. That is the objective. So, in that aspect, Karnataka College has done a lot of good work, particularly the field of research as much of scientific model way research is done with Societies. I endorse your statement that Ayurvedic drugs, those Societies will use, they are not causing any harm. Nobody till this day has taken us to the court of law for side effects caused by Ayurvedic drugs. Whereas there are a lot of cases against modern medicines who causing side effects. Particularly when the two incidents are just telling you here. One of our students, associate students, has sent the Mallabasma to the animal experimentation at the Ramaya Medical College. They worked on that, took the animal experimentation. But in dose of 30 times the recommended dose, the animals were safe. There were no toxic effects. And I want to know even like toxicity or what was the toxic results of effects were there. The same in non-Vasco, which usually blamed. There is also the dose of 40 times the recommended dose. It is safe. It has been done by the maternity hospital. So these reports are signed by the modern doctor. They are with the department to file. So this is the safety of our resources because I think the source is such a balanced plant. For example, mercury is toxic, but we use mercury blindly. But whenever you use mercury, there is a gandak. Gandak is an antidote for mercury. Gandak is also toxic. We use blindly the Gandhaka Sayana. We never came across any side effects of such prescriptions because Gandhaka Sayana is prepared out of milk preparations. Milk is a mechanical liquid for the Gandhaka. So this is the science. When the modern medicine was not moving anything, at that time, some 1,000 years back, our people have recorded all these things. They have observed and recorded. That's the beauty of our science. So, with this scientific outlook, if you look at Ayurveda, probably you will find the strength of Ayurveda, and I hope you will practice with confidence. What you require is just confidence. If you are so confident to just take Ayurveda to the next level, then there is a support by Dhanvantari. As Tarnath College is having that concept. So that is whatever we do here, that all is converting to success. Particularly, Madhav Diggavi was aspiring to have such a laboratory. But finally, he was aspiring, but it was not possible in the government sector. But now it is possible here. Think positively, think always positively, strong determination, things will change. This is the example here. Right? Now, about the different things are there, I do not take much time. As Dr. Murali Krishna was talking about Daivika Chikitsa, it is most important because Atma Sanyoga, if that is there, then only there is a Santan. Just mixing up Sukha, Shonika in a Garbhashaya may not take this. That is not artificial insemination, etc. Sometimes they are failing because the Atma is not associated there. That is why you have to invite Atma. To invite Atma, probably the Daivika Chikitsa is a must thing. And one more thing, don't think Vajikarana is limited only to the infertility. Vajikarana has broader application in future days, particularly in all the Vyadis. In genetic disorders, Vajikarana has a role. As he correctly mentioned, your Putra Pautra. And this is the, then in genetic disorders also, we can take up this Ayurveda, this Vajikarana as one of the tools for future genetic therapy. So that is why think in that direction. I hope Mother Gavi at least will try in some cases, where in genetic disease corrections, this Vajikarana can do. You need to discuss. Vajikarana is not just for, many times we discuss, it's not just for infertility problems, but it's also for Adivodika. That is why Vajikarana has a wider applicability in future days. That is why get prepared and take the message from this college. So with confidence, start practicing Vajikarana, particularly in the concept of uttarabasti. Take that one. And one more thing, as he has shown you the pictures. If you think that it is impossible for to establish, I give one simple example. In Ballari, some allopathy doctors, 25 allopathy doctors have combined. They purchased an instrument which is costing about 4 crores for just investigations and for some corneal surgery. Robert will be doing all this. They invested. All these 25 people have combined and invested and established a laboratory, the medical center. And all doctors will come, make use of it, they go home. So in this way, don't think individual can start some type of laboratory. As a private practitioner, you can have a community team. As a team, you can establish these things. Then everybody can make use of such laboratories, and that can be possible. Just don't look at the arrangements and cost of this. It is possible to have combined approach, and you can establish at least in one city one such laboratory. If it is there, then probably we can reach more people with the solutions what Vajikarana can offer to the masses. With these words, I thank Dr. Madhav Diggavi for having me an invitation, because I am always be happy. If just I am always waiting any call from college, any call promise, because just coming here, standing here in this particular atmosphere, in particular this land, I always feel myself energized. So for having me here and providing some energy, thank you for that. With these words, I thank you. Thank you.
It's my honor and privilege to thank Dr. Madhav for the brainstorm. And I also thank Dr. Vishwa sir for your valuable insights. Now I request Dr. Vishwa sir to join the podium. President Dr. Shikhar sir.
ಆದಷ್ಟು ಬೇಗ ಬರುತ್ತೆ ಆದಷ್ಟು ಬೇಗ ಬರೋದು ಟ್ರೈ ಮಾಡ್ತೀವಿ ಒಂದು ಅದಕ್ಕೆ ಇದು ಬೇಕಂದ್ರೆ ಗಾಡಿ ಕೊಟ್ಟು ಬರ್ತೀರಾ ಸರ್ ಪ್ಲೀಸ್ ಕೊಡ್ಕೊಂಡು ಹೌದು ಕೊಡ್ತೀನಿ ಅಲ್ಲ ನೀವು ಅಲ್ಲ ನೀವು ವಾಟ್ಸ್ ನಮಗೆ ನೀವು ಕೊಟ್ಕೊಂಡ್ಬಿಟ್ರೆ ಹೊರಂಗೆ ಸ್ವಂತಕ್ಕೆ ಮಾಡಿ ಕಳಿಸ್ತೀವಿ ಸರ್ ತೊಂದರೆ ಆಗೋದು ಮತ್ತೆ ಮರಿಬೇಡಿ ರೆಡಿ ಅಷ್ಟೇ ನಾವು 2 ಸೈನ್ಸ್ ಕೊಟ್ಕೊಂಡಾಗ ಮಾಡಿದ್ವಿ ಮಾಡ್ತಾರೆ
We'll have a short lunch break. At 2:45, we'll meet for the uttarabasti demonstration at the hospital.
We'll have a quick lunch break. After that, we have demonstration of uttarabasti. Then we'll have a group photo in the ground floor. Then we'll go to the endocrinology lab and come back here. 3 more clinical presentations are there. After that, panel discussion, question answers and panel discussion. Then we'll have a lunch. Is it okay? ಇಲ್ಲ